Good morning. I want to welcome everybody. I'm really excited about this workshop. The workshop is basically put on by our Center for Health Equity Research at the NAU, and it's sponsored by a number of groups, but primarily the Arizona Biomedical Research Center as a part of the Arizona Department of Health Services. I'm really looking forward to the workshop on the Live Black experience. It's going to focus on the state of Black health in Arizona, especially in light of the impact of COVID on already existing health disparities and health issues. We're looking forward to continually working with the Flagstaff Live Black Experience Coalition, the community coalition, and with CHER and with Arizona Biomedical Research Center. And I want to get straight to the workshop, which is far more exciting than any kind of welcome we can give you. But let me introduce Dr. Linnea Evans, who is an NAU researcher examining social exclusion processes and is focusing on the Live Black experience. And then also Jermaine Barkley, who is a co-lead on the Live Black Experience project. These folks are experts in this area, and we're really looking forward to their contribution. So thank you on the behalf of Center for Health Equity Research and Arizona Biomedical Research Commission and the Flagstaff Live Black Experience Community Coalition. Welcome. We're glad you're here.
Good morning, everyone. Y'all doing okay this morning? Thanks so much for joining us here on a Friday morning to talk about a really light and super accessible conversation. We're setting out today to very easily and succinctly summarize several hundred years of health disparities as a result of racial injustice for our people. But before we do that, you'll be hearing the phrase the lived Black experience probably throughout this morning and this afternoon. So I just wanted to provide a little bit of context as to what that is. Before I do that, I do want to just acknowledge one more time my partner in crime on this event, Dr. Linnea Evans, if we could give her a hand. She's been instrumental. I owe her a coupon for a back massage for carrying the team on her back this entire time. So she did all the hard work and I just get to come up here and look pretty. So I am currently serving as the vice chair for the Live Black Experience project, which is specific here to Flagstaff and the greater Flagstaff community. And want to give some context as to how that got started really briefly before we actually kick off our event. When George Floyd was murdered, I remember going through, like many of us, lots of senses of grief and anger. And that by no means was my first introduction to the topics of social injustice for my people. But it provided a really good opportunity to try to seize on to the energy in the community and do something about it. So I set out and I said to myself, okay, I know what I believe. I know what I want to see happen. So let me try to get out into the community and do that. But I wasn't sure where to start. So I met with all kinds of local grassroots initiatives, local coalitions, young people who were excited about making a difference, to try to see how can we make a change here, right? I was angry, I was passionate, I wanted to make a difference here. And I had a group of folks who, wanted to protest and wanted to change policy on how we do policing here in Flagstaff. And we were kind of chomping on the bit, and there were a lot of internal disagreements about what that looks like. And then one day I looked around the room and realized that I was the only Black person in that room talking about police violence towards the Black community. And I was like, oh, well, maybe that's why I'm not quite making the progress I want to make here. And I was sitting on a city council meeting where they were discussing the budget for the city. And the big conversation in Flagstaff was, do we cut the police budget? There was a lot of people like, yes. And then obviously a lot of people were like, absolutely not. It was a really polarizing conversation, a lot of different opinions on the matter. And then I remember the city council reading one of the submitted statements that more or less said, pump the brakes. We are the Black people that live here. Before you make any decisions, please talk to us. And the city council said, okay. And I said, wait a minute, I'm a Black person. I would like to be part of that conversation too. So I showed up to the Murdoch Center, which if you haven't been to is right down the street off Butler. And I knocked on the door in the middle of the week in the morning. And lo and behold, Miss Deb Harris was there, our chiefess. And I said, hey, here's my resume. I want to be a part of this conversation. And out of a lot of work and labors of love and years of our own personal experiences, we were able to put some great minds together to come up with the Live Black Experience project, which is what we're sharing with you now. So the crux of what we are really hoping to do is that we believe that in order for the city of Flagstaff to actually fulfill its mission to protect and enhance the quality of life for all, they need to take deliberate action to address the needs and the concerns of the Black community. You might hear us here locally refer to ourselves as a forgotten people. You know, it's not, I know it's easy to look at Flagstaff and say, oh, it's just like Atlanta, plenty of Black people here. That's a joke. You know, I know it's easy. It's easy to come to Flagstaff and look around and think that we're not here, right? Or think that the level of integration is such that it's not really a conversation that needs to be had, right? The cultural impact of the Black community in Flagstaff just isn't that large. It's easy on the surface to look at that, but we beg to differ and disagree and think that in order for us to grow as an entire community, we have to address the specific needs of certain populations, including our own, even if it seems small, because inequities do exist. So the coalition's inception, once we started to get together, we decided to come up with a strategic plan, and we engaged in public participation where we had a series of public conversations during a pandemic over Zoom and Teams when that stuff was still new, to just get a sense of how do you folks feel as people of color, as Black people, and as other community members and allies about mental health in the Black community, social justice and criminal justice, youth concerns, economic advancement in the Black community. And we came up with these key goals, which was to identify key issues of concern of the public and investigate the needs and perspectives of our community members, to elicit the input, expertise, and knowledge of community leaders and gatekeepers for the Black community, to ensure inclusive dialogue with various aspects of the Flagstaff community, actively listen and facilitate difficult but meaningful conversations, to ensure that the community of impact, which is the Flagstaff Black community, was engaged and involved throughout all phases of strategic planning and project design, and then to collaboratively work with both community members and city staff to represent and craft a plan encompassing all engaged voices and perspectives. We really wanted to just make sure we had a seat at the table. And we didn't want to lose that momentum, right? The country was having an in-depth and very passionate conversation about, once again, inequities for the Black community and racial injustice. And we wanted to make sure we were actually a part of that conversation and decision-making process. And so we came up with 4 core pillars or strategic goals to grow and strengthen an equitable, resilient, and thriving Black community. We wanted to look at community engagement, where we partnered with the community to develop, improve, and sustain relationships. We wanted to enhance our community infrastructure, which is to intentionally partner with the Black community to develop ongoing programs of education, celebration, and economic development. And then to outreach, which is to educate, to have difficult conversations, to increase accessibility, economic equity, and access to social justice within the Black community in Flagstaff. Really, we just wanted to make sure we were being seen and that we were being heard. In action, this created 6 core subcommittees that we actually operate out of the Live Black Experience. One that works on representation and preservation, one that works on economic inclusion and impact, race, space, and segregation, mental and behavioral health, youth perspectives and concerns, and social and criminal justice. I think I'm missing a couple of slides here, so I apologize. And so that's looked all kinds of ways. It's looked like doing a Juneteenth and Christmas Black Business Expo in the past. We do these kitchen table and barbershop talks that we allow folks to attend in live time, where we talk about all kinds of different ththings. What does motherhood mean in the Black community, and how do we define it? We had a whole conversation about Will Smith slapping Chris Rock, because there's more meat to that than maybe meets the eye. We have conversations about important verdicts that come out, about what it means to be a father, about different perspectives on how we define advancement and criminal justice for the Black community. And we have those conversations out in the open for everyone to see, and as vulnerable as possible, so individuals can participate and ask questions, because we feel like that's where the learning really happens. Lucky for you folks, we'll have a good opportunity to do that today. And our big thing that we're really seeking to do is to speak truth to power in this community on all kinds of different initiatives, whether it's related to housing, economic advancement, whether it's related to the city budget, or how we celebrate different cultural holidays. We want to make sure that our perspective is heard in all different realms, because we are members of this community and we're important members of this community. So as we go throughout today, I just want to frame something that I think is really important. Advancement in equity for any group of people is advancement in equity for every group of people. It's important to remember that. So today we'll be talking about our own experience as Black people, right? We'll be talking about some of the lessons we've learned from COVID-19, some of the challenges we face, some of the resiliency that we have as a community to get over those challenges. We'll be talking about research. We'll be talking about our individual personal perspectives, and we'll be talking about it from the lens of being Black people. But remember, advances in equity for a group of people is advances in equity for every group of people. So pull lessons out of these conversations, ask difficult questions. We want to foster a safe and vulnerable space here where we can have a good conversation and walk out of it, not just patting ourselves on the back, but with a bit of homework and a bit of fire, and some plans and ideas and good trouble ahead on the horizon. That's our big goal today. You'll see us out in the community. This isn't the only thing we do. I really do want to thank our partners at CHER for allowing us to partner with them on this conversation. It's a huge honor. You'll see us at Juneteenth. We partner with the African Diaspora Advisory Council, which is an advisory council to the county that advises county supervisors and county officials on all things African diaspora and the Black experience. And you'll see us in the community, again, speaking truth to power. So again, apologize, I'm missing a couple slides here. So that's the end of these slides. It's an honor to introduce our next speaker. Dr. Mako Fitz-Ward is the director of the Social Transformation Lab and assistant professor of African American and Women and Gender Studies in the School of Social Transformation at Arizona State University. Her research and collaborative partnership work amplify community social networks and data-informed learning opportunities for organization leaders on diversity, equity, and inclusion at the individual and organizational levels. She is a co-editor of the Pandemic Reader, Exposing Social Injustice in the Time of COVID-19, and served as the research lead on the Women in the Mix study sponsored by the Recording Academy. Her writing has appeared in a wide range of academic journals, edited volumes, and popular news blogs, including the Huffington Post. So please join me in giving a warm welcome to Dr. Mako Ward.
Let's see. Well, good morning. We're still in the morning session. So good morning, everyone. First, I just want to say a big thank you to Jermaine, to Dr. Linnea Evans for the invitation to be part of what I see as this, I'm hoping, the start of continued dialogue, conversation, collaboration among researchers, healthcare providers, and community advocates across the state, and particularly those of us with vested interests in the African and African American communities across Arizona. So thank you again to the organizers. So I want to just begin with a short kind of story about my background and how I come to this research. I am not a public health professional. I have not spent the majority of my career looking at public health issues through the lens of a kind of conventional applied disciplinary viewpoint, right? So how did I, as a scholar of African-American popular cultural studies, Black feminist social movements, how did I get involved in research on Black health and advocacy? So my background, I'm a social scientist, trained as a mixed methods Black feminist researcher. And my research explores the intersection of Black cultural production, culture industries, namely the music industry, and urban placemaking efforts to really advance arts practice and foster inclusive community development. So I work with artists, I work with creatives, I work with folks who are by life's calling, very much called to the creative arts for the purpose of social transformation and social justice work. I study social movements. I look at the role of artists in urban placemaking efforts, in trying to advance a version of community development that is equitable, that is attuned to the needs and desires of communities, and in many ways, African-American, Latinx, immigrant communities that have migrated to urban centers. And as a result of shifts in urban development over the last 40 some years, have been priced out of those neighborhoods. So that's a little bit of background on kind of my own research and my interests. And so I spent a good portion of my career working with social service agencies, particularly around issues of housing, housing insecurity, gentrification. That's where I kind of come into this. And in terms of my training, again, I sort of lean on the fields of sociology, American studies, women's studies, African and African-American studies as my sort of disciplinary homes. So I think it's important to kind of name my social location and how I enter into this work. And I will come full circle back to why I think the diversity of academic training and disciplines, particularly folks like me who have a vested interest in culture, in the study of Black culture, and as one of my graduate students who's working on this brilliant master's project on Black queer community wisdom. So I find myself using that concept because we are in lots of conversations about what constitutes community wisdom. So researchers who have a vested interest in culture often don't get brought to tables when it comes to conversations about public health and the health and wellness of Black communities in particular. Most recently, I led two research teams for two large national survey projects. One, which was mentioned in my bio, was sponsored by the Recording Academy to examine the experiences and disparities for women and gender expansive individuals in the music industry. And the other, which was led by a series of Black DEI consultants and experts, looking at how Black professional women transition from surviving to thriving in the workplace. So these are large survey projects that were extremely informative. But recently, I did a presentation for the Academy out in California on the research. And when we got to the Q&A portion, guess what the women in the space who were, these are all members of the sort of West Coast chapter. So these are women who have very successful careers in the music industry as songwriters and producers and engineers and tour folks. Guess what they wanted to talk about? They wanted to talk about mental health. They wanted to talk about self-care, and they wanted to talk about access to wellness resources and how music industry organizations can step up and do a better job, particularly for performers who aren't as successful, folks we don't know, people who work as gig economy employees who have 3, 4, and 5 different streams of income just to make ends meet as creatives and as musicians, right? So they wanted to talk about mental health and self-care. And more recently, in my role in the Social Transformation Lab, I've had the privilege of really working with and supporting nonprofits and a handful of for-profits and really trying to develop strategies and tools and sort of inclusive learning opportunities that will help them reimagine their organizations in different ways, help them to strategically plan their, what I often like to refer to as their DEI journey, right? I think since the summer of 2020, organizations have been moved, in some cases by force, to address issues of structural racism, the way in which misogyny and homophobia and misogynoir show up institutionally inside of their organizations. That these are not just everyday acts of microaggression launched against the bodies of historically marginalized individuals, but that there is a structural, that it's baked into the fabric of almost every organization in our society across sectors. And so how do these organizations begin to create spaces where they're talking about inclusive workplace cultures? How do we get to a climate of care? How do we instill ethics of care in our organizations, right? So I wanted to start with the story about my recent experience, because as the quote says here from Booker T. Washington, the spectrum of social justice work inside of Black communities has to talk about health and wellness seriously, and consider them as, the serious sort of consideration of how to best understand the impacts of structural racism and institutionalized violence. And so for women in the arts, from Black women in music to women in tech, to women in higher education, right? The through line is often our ability to sustain our lives, to have access to the healthcare resources that we need to move from survival to thrivance, right? So today I'm going to talk just about a few things, and I see my my offering in this space as a way of presenting some frameworks, some different lens by which you begin to think about how you enter the work that you're doing, and how you think more expansively about who should be at the table. Who are some of the academics or activists or advocates or areas of our communities that we're not thinking about when we're building our campaigns and we're sort of implementing coalitional, collaborative, community-based research work. So I'm going to talk a bit about the elephant in the ether that is planet Earth, which is COVID-19 and racial injustice. I'm going to talk about sort of the immense kind of priority of eliminating structural racism, and that any campaign towards the betterment of health inside of Black communities has to begin with the elimination of structural racism. And if your work is not tackling the elimination of structural racism, then you are essentially doing Band-Aid work. No shade to social workers, but that is Band-Aid solution work, right? That we have to begin to figure out solutions to some of these hard-hitting, as Ibram Kendi talks about in his book, How to Become Anti-Racist, racism is calcified, right? And so how do we begin to just pick apart the ways in which racism has so fundamentally organized our society and our communities? And I'm going to present two frameworks. One comes directly out of the work of one of my colleagues, Dr. J.T. Rohn, and that's the Black Ecologies framework. And the other is a social justice framework. So let me just begin with some data points that I think really sort of complement our earlier presentation. And this is as of yesterday, right? The World Health Organization reports that globally, there have been 528 million confirmed cases of COVID-19, just over 6 million deaths, which constitutes about 6.6%, in terms of cases, 6.6% of the world's population, 5% of all deaths worldwide, according to recent data within the last 3 months, is from COVID-19. According to Think Health, COVID-19 deaths ranked 4th in leading causes of death worldwide, behind heart disease, stroke, and chronic obstructive pulmonary disease. The US has the highest number of confirmed cases, and nearly 60% of the US population has contracted COVID-19. So while the US reports the most coronavirus deaths and is the highest ranking of the wealthier countries, it's ranked 7th in mortality, behind countries like Mexico, South Africa, Brazil, and Russia. And according to the CDC, now if we take it from a global perspective to a national perspective, African Americans make up a similar share of cases relative to their share of the population, so 13%, but account for a slightly higher share of deaths compared to their population share, right? And this pattern has been consistent since about October of last year. White Americans account for a lower share of cases compared to their share of the population, but a larger share of deaths compared to their share of the population. And this largely reflects a higher death rate compared to other groups during the last quarter of last year amid the Omicron surge. So when we look at Arizona, we know that the state has one of the highest positivity test rates in the US and disproportionately higher cases and death rates amongst Black, Indigenous, and Latinx communities. Black Americans make up a similar share of cases relative to their share of the state population and account for a lower share of deaths compared to the state's population. And this is based on data from the Kaiser Family Foundation. So early in the pandemic, Latinx, American Indian, and Black Americans had higher rates of COVID-19 cases compared to their white counterparts, with a particularly high rate among Latinx communities. However, by mid-August of last year, infection rates rose again across all groups, reflecting the spread of the Delta variant. But these rates were initially higher amongst BIPOC communities. And by September of last year, infection rates across BIPOC communities had mitigated and in some cases became closer. So I think it's important to sort of situate some of these shifts in rates amongst BIPOC communities across our country. To suggest that, right, as of the beginning of this year, we know that infection rates have fallen, that disparities have slightly narrowed, but overall, BIPOC people have experienced higher rates of COVID-19 infection and death compared to white Americans, particularly when accounting for age differences across racial and ethnic groups. This data also suggests that while these disparities have narrowed over time and over the course of the pandemic, people of color are still disproportionately impacted by surges caused by the new variants, Delta, Omicron, Omarion, Decepticon, whatever the next one will be. Rest assured that people of color will be most impacted by these surges. And this is a constant across socioeconomic groups as well. And that's a really important piece to this conversation, right? That no matter, and I think this speaks very much to the sort of demographic profile of the population surveyed here in Arizona from the previous presentation, that even when you have done everything that Americans are told to do to advance their social mobility, you have a higher education, you have access to higher income, you have access in some cases to disposable wealth, especially if you don't have children. Even when you're doing all the things that the American dream narrative tells us to do to succeed and advance, if you are a person of color, it doesn't matter. It doesn't matter, right? So I think some of the more heartbreaking statistics have been around maternal child health, maternal mortality rates, right? The fact that Black women across socioeconomic groups have the highest rates of death in childbirth than any other group here in the US. Again, no matter how educated you are, how much money you have that good job with those good benefits, you are still in the same space of precarity as folks across the socioeconomic spectrum within your non-white racial ethnic group. So across the world, just under 68% of the world's population have received at least one dose of the vaccine. And 62% of individuals are fully vaccinated, having received 2 doses, right? The US is higher in partially vaccinated rates, about 78%, and slightly higher for those fully vaccinated at 67%. National data from the CDC shows that 57% of African Americans have received the vaccine, compared to 85% of Asian Americans, 65% of Latinx communities, and 63% of whites. In Arizona, the percentage is 51%, and the percentages are lower compared to the vaccinations, to the national averages. And these trends are similar for vaccination booster rates, as well as vaccinations among children. And Arizona is ranked 30th among states for percentage of the population fully vaccinated, yet it's ranked 24th for new deaths per 100,000. So over the course of the vaccination rollout, Black and Latinx communities have been less likely than their white counterparts to receive a vaccine, but these disparities have narrowed over time and have been reversed for Latino populations. Research from our colleagues on the AZ COVID-19 SEAL Consortium project revealed the factors related to vaccine hesitancy, which was talked about earlier, and refusal, namely religious and political beliefs, lack of effective communication and community engagement approaches, and persistent social inequalities at the structural level. All of these are exacerbated by structural racism and racial and ethnic discrimination from healthcare systems and government agencies. So I think for someone who has been in the US Academy for coming on 17 years now, it's almost as if I have a certain kind of, what's the word, like eyes glazed over when it comes to reading study after study after study that reveals and really contributes to the building of a historical record. And the historical record often reminds us people of the African diaspora have been subjected to the violence of medical research, right? From, the enslaved women, Anarcha, Lucy, and Betsy, all the way to Saartjie Baartman, to the Tuskegee experiment, to Henrietta Lacks. Our inability to access quality healthcare in mass across our populations, it's not only devastating, but as legal scholar Patricia Williams writes, it's a form of spirit murder. It's a form of it engenders a kind of collective grief. So as I was bearing witness to the earlier presentation, you could not only observe grief exposed through presentation, but you could feel the collective sigh amongst folks in the room, and a kind of sigh that is all too familiar, right? It's a kind of feeling that we are here yet again. And I've been having these kinds of conversations with respect to the tide turning around reproductive justice and reproductive rights. But I also had the privilege recently of spending time with elders in my family as a result of a death in the family. And talking to my aunts and uncles who are in their 70s, having them express that same sigh of, we are here yet again. Is this ever going to change? That is the feeling, I think, I have no words to really express the kind of research and or coalitional activist work that is needed to eliminate that emotional affect. How do you eliminate the affect of collective grief that African Americans have experienced day in and day out throughout the pandemic, but is not specific to the pandemic? It's just familiar. It feels like Tuesday, right? So I also want to uplift the concept of earned caution that Anne spoke about earlier, and that rational sort of learned behavior that's rooted in the socio-historical legacies, again, of structural racism. So a recent publication in the Clinical Infectious Diseases Journal argued for a dual lens approach to understanding the disparities exacerbated by the pandemic, right? So first is the biomedical approach, right? The biomedical lens, or considering the disproportionate prevalence of chronic mental conditions, lower access to quality health care, higher uninsured rates for BIPOC communities when compared to whites, right? Long-standing health disparities and access to quality care contribute to the disproportionate deaths among African Americans in particular. And as a music scholar, I sound like a broken record. If any of you still listen to records, you sound like when the record's at the end and you just hear the loop. You just hear the loop. As I was preparing this presentation, that was the sound that was in my head, was that loop of a record. Like, I'm saying the same thing I was saying in graduate school when I was like so proud to do presentations at sociology conferences where all of this information was new to me in terms of the specific data and rationales. And 17 years later, it's the same loop over and over again, almost like a drum beat. The second is the social determinants of health lens, right? Which we're probably most familiar with, right? And when we think about a kind of retrospective of past pandemics, they reveal the lack of systemic engagement with addressing the social determinants of health, or the conditions in which people are born, grow, live, work, and age that are shaped by the distribution of money, the distribution of power and resources at the global level, the national level, and at the local level. This includes socioeconomics, again, access to healthcare, education, environment, housing stability, food stability, job security, and I think most importantly, social support networks. The resulting economic downturn that was caused by the pandemic required government intervention to prevent, at the macro level, at least this is what kind of how it's been framed, to prevent a ultimate collapse in the global economy, right? We have to immediately invest, and we can, because that's what we could do. We saw how fast, right, aid became available to US citizens. But the rationale wasn't, we have to help people. The rationale was, we have to save the global economy from any collapse, right? At the meso and micro levels, it's the devastating hardships on the world's most vulnerable individuals, communities, and localized systems of care. In 2014, US federal agencies collaborated with the World Health Organization, the World Organization for Animal Health, the Food and Agriculture Organization of the United Nations, and 30 countries to establish what was called the Global Health Security Agenda, preventative measures and rapid responses to biological threats of international concern. Health experts warned that without acknowledging the impacts of poverty, inequality, and social determinants of health, on the transmission of infectious diseases, local and global health system responses would only further exacerbate unequal burdens of morbidity and mortality. However, the compounding politics of right-wing nationalism and anti-Black racism evidenced in the wake of the racially motivated killings in the United States of George Floyd, Breonna Taylor, Ahmaud Arbery, and the social uprising that ensued. All of that preserved these conditions, right, to sustain the disparate impacts with little hope for structural change. So even though you see these kind of moments of opportunity where global health organizations are coming together, making commitments to enact structural change, as political tides turn within the nation state, it either supports or greatly hinders the ability and to really develop a momentum for any of these global health initiatives to go anywhere. So I want to pause on the conversation about health and take us to a kind of larger philosophical conversation. And that's a conversation about the racial contract. I think many of us, you know, if you've kind of grown up through the US public education system, you've learned of the social contract, Thomas Hobbes, you know, we all agree to let go of certain absolute freedoms in order to live a protected life. We give up certain freedoms. And in some cases, we don't even know that we're giving them up, but we give up these freedoms, absolute freedoms, to be protected by the nation state, right? Classic kind of political philosophy. But philosopher Charles Mills in the early 90s, 1997 actually, wrote a book called The Racial Contract. And in it, at its most basic core, right, he critiques the social contract. He says the social contract, it's an agreement, right, pertaining to the political and moral obligations between the state and all of us as individuals. It grants the state the authority over us and responsibility for maintaining the social order, right? Law enforcement. And I would argue that when we think about maintaining the social order, that also includes the social welfare state, right? How do we care for people? But at the same time, the individual is also granted certain rights, protections, and freedoms. And despite being founded upon a discourse of universalism, Mills argues that the social contract was, in fact, from its very inception, inherently racialized. It was always about the protection of white individual interests, right? It rests on these three claims: that white supremacy at the local and global level exists and has existed for many years. Whether we call it white supremacy, we call it nationalism, we call it populism, or we just call it the federal government. White supremacy is real. It is not a fiction. It's not a piece of fiction. It is also not just a term used to classify particular organized radical social groups. That white supremacy is an institution and has been institutionalized, and that it should be thought of as itself a political system. And that as a political system, white supremacy can illuminatingly be theorized based on a contract between whites, which he calls a racial contract, right? So I just want to briefly read a portion of an essay in the Pandemic Reader that my colleagues and I edited. And this was an essay that was written by staff writer from The Atlantic, Adam Serwer. And in the essay, he's talking about the pandemic and the racial contract. He says, but the pandemic was introduced as a new clause to the racial contract. The lives of disproportionately Black and brown workers are being sacrificed to fuel the engine of a faltering economy by a president who disdains them. This is the COVID contract. Black and Latino workers are overrepresented among the essential, the unemployed, and the dead. Yet this is a very old and recognizable story. Political and financial elites displaying a callous disregard for the workers of any race who make their lives of comfort possible. But in America, where labor and race are so often intertwined, the racial contract has enabled the wealthy to dismiss workers as both undeserving and expendable. White Americans are also suffering, but the perception that the coronavirus is largely a Black and brown problem licenses elites to dismiss the impact. In America, the racial contract has shaped the terms of class war for centuries. The COVID contract shapes it here. And he's making the case that, and I'm sure we recall, if we think back to sort of news stories from early 2020, as the public was becoming more aware of the disproportionate cases in Black and Latino communities, it also coincided with a sort of egregious disregard for any sort of federal government response to managing the COVID crisis. Because if the people that are dying are already seen as disposable, expendable, right, of lesser value, then it doesn't behoove the government to do its fundamental duty of upholding the social contract. And it further affirms Mills's notion that there is no social contract. What we have in America is a racial contract. So the death of George Floyd, Breonna Taylor, Tony McDade, and many others invigorated movements for intersectional racial justice. And as we've said, throughout every facet of society, organizations were called to address bias, structural harm, and creating a workplace environment of care. As a former faculty head of an academic unit, African and African American Studies at ASU, a field that was born out of protest, student protest specifically, one that demands a more inclusive higher learning curriculum. The past 2 years have been one where I, along with many of my colleagues, have been called to serve and to take part in conversations, planning sessions, committees, events, public and scholarly opportunities, all for the sake of making sense of the convergence of multiple pandemics that we're all living through. But also as a reminder, if we hold the racial contract to be true, that even though those inalienable rights aren't extended to people that look like me, we in the 21st century are expected to serve institutions in figuring out the solution to the problems that they created in the first place. So that is the conundrum that I think we find ourselves in, especially as Black researchers, as Black activists, healthcare workers, community support, community caregivers. The conundrum that we find ourselves in is that we are meant to find the solutions to problems that we did not initiate. But that is also a burden, right? And it's important, again, I go back to this point of accomplishing health equity begins with eliminating structural racism. And that for me is what allows me to hold that burden with less rage, right? So to be in a predominantly white institution where it is mostly the faculty of color, the students of color, the staff of color, more specifically Black, who are turned to problem solve with little support, little financial incentive, and no guarantee that the ideas, because we're creative people, that the ideas we come up with are actually going to be executed by these institutions. There's no guarantee. So we are constantly operating from a place of faith and hope. And, faith and hope doesn't pay my mortgage. So, and I have said that, I have used that phrase in numerous spaces. This is cute, but faith and hope don't pay the bills. So I need to see checks. I need to see in writing, how are our larger institutions going to commit on paper, not in pledges? How are they going to commit? Because we're willing to do the work, but we just have to know we are going to be supported. And when we give those ideas, the institution is going to say, we're ready to move, let's go. And so I think, Dr. Evans spoke eloquently about how structural racism increases risks, right? We see how Black Americans are more susceptible to infections due to exposure through work, housing, etc. But how do we address this, the elephant, the giant behemoth of structural racism? That's always the question. Okay, where do I start? Well, one, we have to define it. You have to know what it is, right? It's the recognition that race-based advantages and disadvantages are embedded into the fabric of our society. Now, I can say that and people go, yeah. But then when we get in a room and start talking about hiring, and we say, well, we really need to have some initiatives where we really invest in hiring not just scholars who have expertise in social determinants of health and racial inequality, but Black scholars who have that expertise. Oh, wait. You had me at expertise, but now you're talking about this like slippery slope of affirmative action, and I don't know if we could do that. This is where you remind them of what structural racism means, because it's not just about the expertise, because expertise is something that, in my opinion, is also a social construct. How institutions, especially the US Academy, which we know has been deeply for generations invested in creating the knowledge production that advances white supremacy, right? How do we get our institutional leaders? And again, it's that loop, it's that record loop. How do we, we're comfortable with the loop. So sometimes we have to just continuously say the same thing in these spaces, remind them of what structural racism is, and that, yes, we are state institutions, but it is most important that we are investing in the people who have been most disadvantaged and erased from these systems. So I want to end with these two frameworks to leave you with a way of thinking about health and wellness advocacy that will get you thinking more expansively and more intersectionally, right? Beyond health and really expanding what we mean by health, right? So this approach, the Black ecologies approach, was coined by anthropologist Justin Hosby and my colleague, historian and geographer J.T. Rohn. And it's a multi-pronged analytic that really is about, first and foremost, taking a historical approach. How do we historicize Black communities? How do we begin to see, and by we, I mean not just people who experience the violence, but how do folks who are outside of our communities begin to take on a historical understanding of the socio-historical legacy of structural racism? How do they deepen their understanding of Black community knowledge? How do you begin to look at the intersections of biological and social existence for Black communities, right? It's also about thinking about the environmental impacts, hence the sort of use of the term ecological, right? That when we think about the wellness of a community, we're talking about the environment in which people live in. And environment isn't a synonym for nature conservancy, land, water, air, although all of those things are part of the environment. But racism, white supremacy, poverty, alienation, and housing insecurity are also part of the environments of Black communities. Now, that's a much harder argument to sell, especially when we're in spaces where we're talking with folks who are invested in the sort of the logics and economics of sustainability. That's code. Y'all can figure out the code. But in those spaces, we have to again, engage the drumbeat of structural racism. Because if you're not talking about housing insecurity as fundamentally an environmental crisis, then you're not doing sustainability work. Have you been to Los Angeles in the last few years? It is tent city on steroids. So you can't convince me that housing insecurity is not an environmental issue, right? It's also about the toxicity of the ways in which land has been stewarded. It's about the byproducts of both production and consumption, and how, of course, they most negatively impact communities of color. But finally, and here's the sort of aha moment, it's about the insurgent solutions, that Black folks have always been about the business of social change. We have always been about the business of making our people and our communities safe and protecting them from harm. I would say in every organization, in every institution, there's a version of the Underground Railroad that exists that allows for Black folks to network, to find support, and to strategize how to conceive of futures outside of destruction and lack, and how to best collaborate across sectors and across differences. So I titled this presentation Ghostly Trajectories because it comes from the work of sociologist Avery Gordon, whose notion of haunting in her book Ghostly Matters emphasizes how violent historical occurrences affect individual and communal trauma as a way to comprehend the pandemic and the Black Lives Matter movement. It takes up time and temporality, right? What we perceive as the past and therefore done, displaced, is actually quite present, right? And historian George Lipsitz talks about time in some of his more recent work and how the Black radical tradition offers us, intellectual tradition, offers us language to think more critically about time. And that for us, there's no such thing as the past. When we think about violence, when we think about racism, misogynoir, there is no distinction between Emmett Till, Trayvon Martin, Breonna Taylor. Monday, Tuesday, Wednesday for us, right? My colleague Ursula Orr in her book Lynching also talks extensively about the idea that in Black communities, time is a very different construct. And I say all that to say that we have to take on culture as an important part of our work. We have to become attuned to the cultural realities, experiences, and histories of Black communities to do better and be better as advocates to Black communities. So the second framework and final kind of end here is social justice. And we know that social justice is a complex idea, right? I'll give you a social work definition. The National Association of Social Workers defines social justice as the view that everyone deserves equal economic, political, and social rights and opportunities. And here I've created this sort of wheel of social justice principles. These are all principles that, for me as someone who's been teaching the sort of fundamental political philosophy of social justice for many years, I realize that these principles are the building blocks to my own understanding of being a conscious colleague, to how I show up as a co-conspirator, as a collaborator in research, and how I teach how you do social justice in the world on an everyday basis, right? Qualities like kindness, joy, gratitude, integrity. Oh, we can spend a whole afternoon about integrity or the lack thereof. An ethic of care, that these are all principles that we have to hold when we're doing any of this work, even as researchers, right? We tend to overvalue the principles of method and technique over these basic human principles of kindness, courage, presence, gratitude, and joy. And that this framework encourages us to reflect on the social problems that impact the quality of life and the ways that communities work to address these problems. So in closing, the Black ecologies and social justice frameworks are approaches to thinking about how you can engage in change work from where you're at. And change isn't just about taking to the streets, marching for justice, although these are very important direct action strategies. It's also not just about demanding for structural and social policy change. Again, very important measures that have to happen. It's also about the ethic of care that we bring to our research collaboratives, to how we engage one another, right? I could tell you stories about the most woke, well-known community engaged researchers. And when you get them in the room, they're not the nicest of people. And so what happens when your research practice doesn't align with how you show up in the world, with the people that you work with, right? We have to model care in how we build right relationships with community. And in the work that I do in the lab, I'm often in conversation with folks talking about, and we often like to use the word inclusion as a verb. So we say to inclusivize, right? Systems change work starts with people. How we engage, the flexibility and openness that we have to new ideas, the ways of knowing and being that we call on. And starting from a place of radical openness allows us to move, as my colleague, Dr. Chandra Krudup says, to move from I work that centers my career, my progress, me and mine, to we work, methods of research collection, data collection that transgress colonial modes of power and ownership in favor of open access, publicly accessible platforms to information to get it out to community. So, 2 key points to leave. Culture plays a fundamental role in promoting health and wellness, right? Thinking critically about race, racism, and power can promote positive health outcomes, right? Earlier, right, presenters talked about critical race theory and the application of critical race theory, which comes out of critical legal studies, not applied health fields, but critical legal studies, but it's been taken up by education and policy and public health, right? And exposure, I feel, to humanistic, creative, and social science bodies of knowledge around African-American history, politics, and culture can really impact the kinds of solutions that are considered among public health experts and healthcare providers. And just as a plug, we are in, the lab has just recently started a project in collaboration with our colleagues in the Southwest Interdisciplinary Research Center, looking at the issue of substance use disorder treatment and prevention in BIPOC communities across the state. And so we are launching a series of focus groups throughout the summer. So if anyone here is interested in participating in any of those focus groups, please feel free to take our email address down and get in contact with us, or come see me at any time during the rest of the day, and I will gather your information so that you can be part of that work. And know that this is a predominantly BIPOC research team. We are committed to the kind of ethic of care in research that I've spoken about, that Dr. Evans and Ann Carver have spoken about. And we are very much committed to Arizona. I grew up in Tucson, so I have some deep roots here. So this is not just research for me, it's personal. These are my communities, these are my family members, and these are my loved ones. So with that, I will close. Thank you.
Thank you, Dr. Ward. As always, you inspire, enlighten, and encourage us to either get on the bandwagon or continue on it with new eyes, new lens, and I just appreciate that so much. Thank you. my question has to do with the idea of social justice. I love the wheel that you had. And I was also thinking how very closely it intersects with self-care, as you
Mhm.
spoke of earlier in your talk. Would you say that social justice emanates or comes out of, emerges out of having a love for self? Now, I know that may sound like you were saying that Dr. Crudup says it's not the I work, it's the we work. So that may be antithetical to what you've said, but I seem to see that there's some parallelism that goes along with social justice and a sense of loving oneself. And maybe in loving that self, it also means that you envelop and respect and honor those who are considered the human family, whoever that may be. But I know that may sound sappy. I don't know. But I
No,
was
I
wondering.
think you're right.
Mhm.
Actually, I just published an essay back in November on the radical self-care movement amongst Black women, particularly looking at certain social media influencers and how they contribute to that discourse, and that there's a very long like self-care feels new, but it actually has a very long history in Black women's organizing, Black feminist organizing. And self-care is not tethered to a kind of consumption model that we're used to. Like self-care equals spa days, self-care equals pedicures, self-care equals paying $10,000 to go see a guru in Santa Barbara. That is not self-care. That is a particular neoliberal version of self-care. And that for Black women, self-care has always been communal in nature, and that starting with caring for the self isn't something that we can do alone, right? Earlier when I met Miss Deb, we were talking about other mothering and the ways in which Black mothers mother in community with aunts and cousins and neighbors and loved ones, and that children are often reared not just by the nuclear family, but by this sort of larger family, right? By the kinfolk. And so I think that self-care from a Black feminist perspective has always been done in community, because oftentimes individual women require the support of others to uplift them. And that there is a very sort of deep rhetorical tradition in Black feminist writing around the uplift of women done by other women, other Black women. And so that essay, I start talking about the way in which we have to really think about the origins of the self-care movement in Black feminist organizing, because it often isn't attributed and it's often not credited to any discussion about self-care in the United States. Because as Bell Hooks says, this is white supremacist or imperialist white supremacist capitalist patriarchy. Let me get the order right. We live in a society that deeply not only undervalues women, but I think Black women. But if you haven't read Moya Bailey's book, Misogynoir Transformed, she coined the term misogynoir. And it is probably the most apt way of thinking about the violent hatred of Black women in American society, from the way Black women are conceptualized in popular culture to the way the historical record talks about how our bodies were used during slavery. That there has always been a fundamental sort of organization of institution to perpetuate violence against the Black woman's body. And that has been documented, right? And so, and I say that, I just say that as if, oh, you didn't know? I'll send you some citations, because that is the sort of intellectual tradition that I come from. And that I think speaks to why it's so important. I'm on this project right now, my colleagues in CERC, they're fabulous, but they don't come from ethnic and cultural studies. And so when I introduce that kind of matter-of-fact way of talking about Black communities, they're like, oh, really? Are you sure? I think I'm sure. I think I'm sure. let me send you something. I'll send you a reading list. And so that's why it's so important for fields like African-American studies, ethnic studies, women's studies, to be pulled into these projects, because we have the deep expertise of Black history and culture to situate certain information as matter of fact, so that we can move on to the work that we need to do. We don't need to sit and pontificate about whether America is white supremacist. Let's just, as my sociology colleagues say, it is a social fact. Let's move on so that we can get to the work of finding solutions, right? Thank you.
Any other questions? And we will also have the panel discussion after lunch. And so if you have a question, then we can definitely have you up here. Thank you, Dr. Ward.
All right, ready to go? All right, I think so. There we go. All right, gang. Hopefully your lunch was good. Was it okay? Yeah. Hopefully if you're on at Zoom land or Teams land or wherever you're watching, your lunch was as good too. Probably was not, because I'm guessing you're home, but that teaches you. Next time, be here in person. We're going to transition into our afternoon now. We've got one more presentation, and then we're going to segue right into a panel discussion Q&A. So please, as this last presentation is going, jot down the last year dying thoughts and questions. It is my pleasure to introduce Dr. Olga Davis, who is the Associate Dean of Barrett, the Honors College at the downtown Phoenix campus of Arizona State University, and a full professor of communication at Hugh Downs School of Human Communication at ASU. Her scholarly work examines the critical cultural nature of communication with a focus on the social determinants of health and health equity among underrepresented communities. She approaches research from a community-based participatory framework involving culturally grounded intervention research and evidence-based contexts. And her dedication to community efforts is seen in her community-embedded research that is translational and participatory in its vision, application, and dissemination, and in her development of curriculum, which aims to shape the research of the next generation of health disparity scholars in the field of health communications. As the principal investigator of the African American Cardiovascular Disease Health Literacy Demonstration Project, goodness gracious, what an acronym. Yes, which is a funded project with ASU's Southwest Interdisciplinary Research Center. She's partnered with Black barbershops to promote knowledge and community efforts towards eliminating the CVD mortality rate among African American men. As the principal investigator of the Community Engagement and Outreach Core of the center's P20 NIH NIMHD Center of Excellence grant, Dr. Davis created a community advisory board collaborating with university and community stakeholders. From her early work on the Tulsa race massacres of 1921 in Tulsa, Oklahoma, building trust with diverse communities as a researcher has been central. Her collaboration with the Refugee Women's Health Clinic as a founding board member ushered in the development of community health navigators in approaching health and wellness of refugee women in Phoenix, Arizona. Dr. Davis's work extends from cultural competence training of third-year medical students to use the narrative of discourse intervention, how humans create identity and co-construct the world through the nature of telling stories, to explore the lived experience of African-American cancer patients and caregivers within the community of the Coalition of Blacks Against Breast Cancer. Currently, her collaborative research team examines the effects of obstructive sleep apnea in the lives of professional Black athletes and the broader African-American male community to enhance health literacy and trust engagement in the community. Dr. Davis employs youth-inspired research to address the difficult questions about our urban and diasporic communities with the goal of achieving an equitable and healthy future for all communities. Please join me in giving a warm welcome to Dr. and Dean Olga Davis.
Well, as you heard Jeremy say, I am Dr. Olga Davis. That's who I am, yes. And I am looking today specifically at some ways to think about health equity, health disparities, and to show you in this particular presentation, the most recent work that I and some of my colleagues have been doing with two most recent articles that we have that has come out and published, and one is in process. It's in press. It will be published online, but mostly I want to talk about communicating purpose in the health of Black and African communities. And I mentioned Black and African communities because I do work with the Refugee Women's Health Clinic under the direction of Dr. Krista Johnson-Agbakwu at Valley Wise, which is the hospital downtown Phoenix that has many refugees. And she created, the refugees come, and that's really a place that takes care of their health concerns and their health care. And Dr. Johnson-Agbakwu started this health clinic for women in 2008. So it's been quite a while now. And it has been noted around the country, and specifically here in the state. There was never one like this. Women who are from that part of the country in the continent of Africa, as well as some of our sub-Saharan countries that are close, they have experienced female genital cutting. Sometimes it's called female genital mutilation. And Western physicians have had no idea of how to treat them or how to take care of a variety of concerns that they have with regard to their kidneys and their bladders. Oftentimes they drip urine as a result of some of the female genital cutting. Sometimes they have odor as a result of that, and so they are shamed in the various kinds of environments that they are in, and particularly Western environments that aren't familiar with what has gone on. So Dr. Johnson-Agbakwu came, very brilliant medical doctor with a background from Cornell University, from Johns Hopkins University, from University of Michigan. She's, one of those top A+ scholars who went to all of the Ivy League schools and, just soared. And she's on top. Everyone knows her around the country and also globally. And so I am very concerned about those individuals as well. And I do believe when I look at the African diaspora, which is regarding Black people that are diverse and Black people that have been dispersed around the world as a result of slavery and a variety of other issues, colonialism, from almost from time immemorial, we know what has happened. And so when I think about Africans as well, they should also be in the mix of this discussion because they too, and particularly if they are refugees, they are seen in even a lower perspective or framework, or they are envisioned differently than even Black Americans. And so I've added a little bit about an article that I have just recently done with my colleagues regarding the worker burnout and wellness with regard to that environment. But before I jump ahead of myself, so this idea of communicating purpose in the health of Black and African communities, I got an email from Dr. Evans, and she said, what might really be neat is if you talked a little bit about your research, and since you're from the realm of communication, and I must say it's not communications with an S. We always teach our students this. Communications with an S usually means media, journalism, public affairs, marketing. And while we do some of that, but our perspective from human communication without the S is referring to that which brings humans together, interpersonal engagement, intercultural engagement, the way that we understand ourselves intrapersonally, that's self. And we talked about self-care with with Dr. Ward a little while ago. This idea of identity. And I am a firm believer that if you don't know who you are and you go through the world, you have missed out on so much and you don't know, you're floundering in the wind. We have to have a strong foundation of who we are, whether that be ethnically, racially, gendered, spiritually, in all different realms, the totality of the human experience. We do need to know, I believe, that we need to know who we are. So this idea of human communication and human communication theory suggests that humans need one another. Isn't that, a concept? Humans need one another. Humans need to connect to one another. And one of the problems I would say that we have in our world, I know it sounds trite, is that we don't know how to communicate. And we assume that someone is someone else. We assume. And so oftentimes when we're afraid, it could be someone of racial difference or of a gender difference. I'm thinking now particularly Black men, although I've had the experience being a Black woman and getting on an elevator. I think me, I don't look like I would attack. I don't think. But it doesn't necessarily mean that the way, that you look or that you would certainly necessarily do that, but it's how you are seen in the other person's eye. And if they are afraid, intimidated, have been told something about people who look like you, then you can get on an elevator and they may feel threatened that you might do something to them, or a variety of different things. I won't go into some of the experiences that relate to what I've just said. But the idea of communicating purpose is very vital, I think, in our discussion for today. Oops. 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 I meant to do this. Oh, thank you. All right, there we go. Thank you. Now, I know that I'm here in Northern Arizona, and you might say, well, you don't have to put that in, Dr. Davis, Dean Davis, you don't have to do that, Olga. But I do start off my classes with this every week that I have my students and I give a talk or a lecture. And now my graduate students are now remembering that we do that. Land acknowledgement. And, and even more so, to me, it's so vital because I'm here at Northern Arizona University. We express our recognition and respect for the indigenous peoples of Arizona as traditional stewards of this land. They certainly have been and are. From the Hohokam people from time immemorial to the current 22 sovereign nations, we acknowledge that the enduring relationship that exists between indigenous peoples and their traditional territories. I don't think that we can express it enough of the stewardship and also the loss of land, the exploitation and on and on. That's another topic, and that's another PowerPoint presentation for another time, but still acknowledging the native people of this land and of this state. So what I'd like to talk a little bit today with you about is the context and implications of COVID-19 in Black and African communities from the perspective of two articles that I'll briefly talk about. And then the communication needs of Black Arizonans and strategies for addressing needs of Black and African communities. So, I might be brief somewhat, but I am a talker, but I'll try to keep it brief. But also, if I don't answer something, then perhaps it can be taken up in the panel discussion as well. And as I thought about the overview and what Dr. Evans had asked me to talk about, I thought this might be something that's parallel to my other colleague speakers, as well as helpful to all of you. I wanted to first contextualize this notion of the lived Black experience. I was so taken aback by that idea in a good way. I was taken aback when Mr. Barkley wrote me, and then also we had a Zoom meeting about the lived experience. And a lot of my earlier work was founded around the Black feminist notions of self-care, and Dr. Ward spoke today earlier about that. And the way that Black women have understood the lived experience. The scholars from the 70s and 80s and early 90s of Black feminist literature taught us that our stories were like rushing winds, were like fluttered leaves that just left as though they never existed. And so when I see that lived experience is grounded in the ways that you all have done for this conference, I was just elated. I mentioned here the everybody want to sing my blues, nobody want to live my blues. That is a song. You might have said, where did that come from? It is a song by the Sounds of Blackness, a gospel group. They sang that probably in the 80s or maybe I think early 90s of that other previous century, the 20th century. But everybody want to sing my blues, nobody want to live my blues is about Black people who can't decide that they can decide, I'm not going to sing the blues today and I'm not going to live the blues, because we live and sing the blues every day. And we still get up and we smile and we repartee and we perform. We perform the identity that we are professionals and that we move forward. But the notion of everybody want to sing my blues is that oftentimes those who are not Black want to embrace what they think are the characteristics of being Black. So, oh, I just love your hair. Can I touch it? And I go, no. This is an art piece. This is a work of art. And as you do in the museum, you do not touch a work of art. But also when you realize that people oftentimes think of you in a very objectifying way, that you are a thing, or not, I don't want to say thing, you are an object. So you could, if it's an object, you would just go up and touch it. If it's a little dog, oh, how cute you are. Well, you don't put your hands on other people. At least that's the way I was taught. You don't just go up and start touching people's bodies. If women are pregnant, you don't just go up and start patting them as though that is your body. And again, as Dr. Ward and Dr. Evans and also Ms. Carver talked earlier, the notion of Black women's bodies are still seen as something that is less than, and that it is an ownership by everyone. And so you don't need to ask, mother, may I? If you remember the little game that children played, mother, may I? May I, or shall I ask before I touch your belly if you're pregnant? So this idea of everybody wants to sing my blues, you think about it when people tan. I was in school in my PhD program and my master's program at the University of Nebraska, Lincoln. And there were students and faculty who would not even speak to me, not even look at me. I was the first Black anything, Black man, Black man, Black woman, Black anything that got a PhD degree in the School of Communication. And that's been a little while ago. It's probably 94, 95. I think I graduated somewhere in there. And they didn't know what to do with me. And so I worked very hard, and sometimes harder than everyone else, because they put me through hoops that I didn't feel others went through. But nevertheless, we finished. And nevertheless, there were always supportive people there to make sure I did have a path, and I appreciated that. But some of the same people who would not speak to me, I would see them lying out tanning. I go, now, what's up with that? And I said, I must write about this. When I finish my dissertation, I'm going to, write something about it. And then I would see them with dogs that were Black dogs. I never understood. I've seen that a lot. And I don't know if anyone has thought about that phenomenon. Some of you who are white and have Black dogs, you might go, oh, I never thought about it, but Sam is Black. Sam is a little Black dog. I don't know if there's some correlation of of black dogs with, white individuals. I'm not sure of that, but I know that I saw a lot of that in Lincoln, Nebraska. And then this idea of, maybe I can dance like you, maybe I can frizz my hair like you, or maybe I can do, have some of the accoutrement that you have, and I can sing your blues. But then if you say, well, if you want to, have a tan and you want to, frizz up your hair and you want to let me know how many black friends you have, then live my blues. Come join me. Come join me and live. Live the lived experience, the lived black experience that we talk about. And nobody, as it says here, nobody want to live my blues. So that song, you might want to go on YouTube and hear it, but that idea is, as the Sounds of Blackness have said, we don't want to live the blues of Black Americans, but singing them and adding on different pieces that we think, whatever we think the Black individual or Black identity is in our heads, oftentimes without even interacting with people. Or rather than saying, I do want to get to know you genuinely, and not like, oh, I have a Black friend. I've had people, oh, you're my first Black friend. Well, first of all, what made you decide that we're friends? And secondly of all, if you're only seeing the color of my skin and you're saying, oh, you're Black, you're essentializing me, and you know nothing about who I am. You know nothing about how I travel, how I've studied a variety of literatures and have friends around the world, and what I think about, what my views are, what the kinds of things I want to do in my life, as all of us are. And so I hope that when you think about the lived experience as the lived Black experience here with this project at NAU, I hope you think about a lived experience is one that values truth. It is a truth valuing agenda. It's a truth valuing experience. It's a truth valuing project. And I believe that's what you have found today, and certainly in some of your other sessions, I'm sure you've seen that. But values truth means you have to hear what people say about who they are, not who you think they are or who you think they should be, but who they are, in order to recognize and also appreciate the truth of who they are. And we always hear now, it's a term that everyone says, honor your truth. Let's hear what the person says about their truth. Speak your truth. So everything is about, we hear those terms, but if you dig beneath words, which I do for a living, what are the words? What's the rhetorical intent underneath those words? Then we see that truth becomes a value. And when truth becomes valued and when truth becomes centered, then disbelief or disingenuousness, if that's such a word, has to go away. Truth is like, truth will disarm you. Truth will bring you to your knees. Now, fraudulence, people who are frauds, they will not bring you to your knees. There'll be something about them, even if you can't really read them, you'll go, something's just not right, because they are frauds. And I'm not talking about imposter syndrome. I'm talking about people who are fake and everything about them, although they may put on a cloak, a performance, if you will, that they are really more than who they are. But when you value truth, darkness or evilness or disingenuousness cannot be in that same environment. It just can't. It can't survive. It has to go. People may go, look, I can't be around. You have to go. Okay, well, you're probably doing someone a favor, but they cannot dwell in the place where truth is, and lived Black experience values the truth of the experience of being Black. It also assumes authenticity. And authenticity, as I've just mentioned, to be authentic means that you are genuine. Doesn't mean that you just get up and say anything, but that you are respectful, that you do have integrity. I'm thinking again of Dr. Ward's circular wheel that she ended up in her presentation today with. And a lot of these comments were there. They were values. They are foundational gems of being human, really. You know, you just, to me, I think, is it that difficult? It's not rocket science, but it is so difficult for us as humans to be able to let go and experience. We don't want to, or we feel someone's watching, or we just feel we have a hardened heart. And if we experience someone, then that means they will have a leg up over us. I've often heard that even from some people I know who are white, who've said, well, you know, if you folks, you Blacks get, you know, an inch, you're going to take it and you're going to take everything away from us. And you're going to treat us the way we've treated you all of these years or centuries. And so that hardened heart remains there, and they will not look at a new way of viewing, a new way of turning it inside, not looking out here, but turning it inside. The man in the mirror, as Michael Jackson said, the song, I'm looking at the man in the mirror. It's a beautiful song. I'm asking him to change his ways. That's something that no speaker can tell you, maybe inspire you, but you have to do it, or not, and remain in that dungeon of you know, that keeps you away from really truly growing and experience life, and the life that comes because you've met others, and most often others who are different than ourselves, others who are different, not necessarily in terms of being human, but we think the difference is because of this. And yes, there are experiences that come because of how we look or accoutrements, but I do believe that there is an element of humanity. And now with everyone talking about issues of genetics, I was hearing Henry Louis Gates, who came to ASU the other week, and he talked about all the various types of genetics that are within all of us. And various, even whites who he has interviewed, have African genetics and Ashkenazi heritage, and a variety of different global heritages that they never knew. And of course, they're quite shocked when he says you have, you know, African heritage as well, genetics, and genes don't lie. So, you know, we're really intertwined so many different ways, but we tend not to appreciate that, and we tend not to celebrate that. The lived Black experience also celebrates how we tell our story or our stories. And I know you know this from being here at NAU with the Live Black Experience project. What I mean by that is celebrating that you have a story to tell. And oftentimes, for example, in my own life, in my own family history, the story of the Tulsa Race Massacre was never supposed to be talked about. I didn't know about it until I was about to decide on and embark on my dissertation topic. And I talked with my father, and he said, why don't you write about Tulsa? And I said, what do you mean? He said, well, there was a riot. At that time, they called it a riot, about 15 years ago. Well, there was a riot in 1921, and your grandfather had and relatives had some involvement in that, and they were taken away, they were killed, they were castrated. I went, what? I never knew anything about this. I said, well, Daddy, I call him Daddy, still call him Daddy. Daddy, I didn't. And then he clicked. The phone was hung up. I went, what? I don't know what happened. So I called him back after, you know, a minute or two, thinking he would call me back. And then he answered the phone. He seemed a little rattled, but he said, yeah. We must have had a bad connection. I said, but I don't know what happened. We were talking, all of a sudden we were hung up. He said, yeah, we just had a bad connection. But what I heard in his voice, I believe he had gotten choked up and probably started crying. And Daddy didn't want me to hear that because he's always been, the dad, and he didn't want me to see that side of him that was so vulnerable. But it was about relatives who he loved, relatives who were living and then tried to stand up for the Black community and were lynched or castrated. And of course, also taken to prison because of the supposed uprising. But it was this beautiful, and again, you can read about this if you haven't heard about it. This is 102 years now, 101 years since the Tulsa Race Riot. So it was 1921. In 2021, last year, there was a big commemoration. And now 2022, just last week, they had a big luncheon for descendants and their loved ones in relationship to the Tulsa Race Massacre. So people are talking about it. They're still trying to find graves. Black people were buried without gravestones, just many of them were in mass graves. And there are no records of their death and of what's happened to them. So now they're trying to find in Tulsa reparations for those who are descendants. And there's a pushback in the communities, particularly white communities there, that now the generations that are here today are saying, well, that was 100 years ago. That might have been my great grandfather who was involved in that, but not us. And then the other opposite argument, a counter argument to that is, but you are still reaping the benefits of being, of having white privilege and of living on in Tulsa. The South Side is considered the white community. Very strange. There's most cities, South Side usually means Black, Latino. But in Tulsa, the white community are the individuals who live on the South Side, and then North Tulsa is considered the Black community that, you can see some homes that have been in shambles, but some places are nice, and churches, of course, there and well kept. And now with the rise of everyone looking at Tulsa from last year in 2021, there have been CDBG funds, city funds that have been sent in to clean up the place. And, because CNN has come in and so many other people have done documentaries about Tulsa. But this idea of celebrating how we tell our story is also how we tell our family stories and how we find the connections of those stories, even to the enslavement, and not to be ashamed of those who were enslaved. I found the connection of enslaved people to be something that was very wonderful when I found out how strong they were, when I found out what they went through. And someone in my family had to have gone through something to have survived it, so that their genetic makeup would have been in my mother and my father, and then they got together, and then, here I am. So you do think someone survived something in order for me to be here. And that is not someone who you should be ashamed of, someone to be very proud of. Lived Black experience reveals story is the narrative of our lives. So story, I do very much on narrative discourse. And that simply means that all of us tell stories. It's part of us, our makeup of being humans. And that persona of being human says that in everything we do, we tell a story. Like today, when we go home, we'll say, oh, well, I went into that conference and I heard Ann Carver speak, and and Dr. Linnea Evans was speaking, and they talked about this, and this. And then I had a chance to meet various people at lunchtime. We're telling a story. We're making an account of our lives. Our day, this one day, is very important because it's an account of our lives. And so that idea of narrative is very important. The Lived Black experience learns about others through telling and sharing experiential learning. And so when we don't believe that others have anything to share with us or enhance our lives because of who they are, we miss out terribly. We learn about others because we tell stories, but we also share. We hear their stories. And I mean, really hear, not just words that go in and out the other ear, but we hear with our hearts, we hear with our minds, and we understand there are dynamics that have shaped a person because of their experiences. And oftentimes those experiences and those structures of domination, structures of power, have caused them to have to go through various experiences. But what about the way they have transcended and transformed? And I found that in my research of Black women in slavery, Black female slave narratives I studied many years ago, and realized how very vitally strong those women were and still are in my mind as I think through the continuity and the continuum of who they are, even in my life. Well, and the lived Black experience validates one's existence and the importance of being. We can't just dispel someone, or we say colloquially, kick them to the curb because we don't like what they say, or we don't like how they look, or we think that we're better than they are. The validation of another person's existence is also to validate yourself. And when you don't validate someone else, I know it seems quite odd, but when you don't validate someone else, it does some sort of quirky, disjointive or disjunctive situation that occurs when we don't validate and honor the existence of another. We also lose out, something that we miss in our lives as a human being. And the importance of being. One day, I don't want to sound cryptic or anything, but one day each of us won't be here. And I'm probably thinking about this because a couple of colleagues are fighting for life right as we speak. One person, I went to see her, a dear friend, professor from ASU. She asked for me. She told her son to call, let Olga know I'm in hospice. And I was in a meeting. I said, okay, I'm on my way now. He said, no, she can't see you today because she's already seeing someone else and she can only see one person per day. Can you come tomorrow? I said, I'll be there. Tell me the time and whatever. And then all of a sudden I thought, what am I going to say? I started getting very nervous, very worried, even though I've known this woman for, like a couple decades now. We were assistant professors together. But to have this, and she said, tell her I want to say goodbye to her. And I can't even understand that concept. And so it weighs on me. She's still living, but she is in hospice, and her son said, it could be a month, it could be tomorrow, it could be a week. So this idea of the fleetingness of life. So that's why I say the importance of being. Please take a thought about it, because there will be a time we won't be. Just us. We all have to go. We know this philosophically, but when you are, I'm assuming when you are faced with life and death, and we hear so many things over the news and so forth, about life, how fleeting life is, even for little youngsters, as we just saw a few days ago. But the importance of being means every day validate one's existence by listening, hearing, and also checking yourself. Checking yourself means check yourself. And that's a colloquial term for check yourself. Check yourself means it's kind of a Black idiomatic discourse. It means check your whiteness. Check your vision of that you are better than someone else. Check it at the door. Don't bring it in here. check it in the mirror as you're shaving or putting on your makeup. Check your whiteness where you are saying, I've got to work on that. I really am not, or not necessarily that you're not, but I have to address the issues in myself that lend the belief that I should have privilege and priority over other people. And I know it comes with the package that, I've had people like walk up past me and stand in front of me at the airport. And I'm going like, what the hell? I mean, I'm not like, a tiny little minuscule woman that you can't see. What the hell? And so, I am, pretty direct, and I'll go nicely, but excuse me, why did you just walk in front of me? Oh, I didn't see you there. I said, really? And then I thought they really didn't see me, because the blinders on them of being privileged is that you don't exist. You're not there. So how can you see something that doesn't register as anything unless it gets in your way? And then it has to be expunged, not to be listened to or to learn from, because it's not worth anything. And so that's what those of you who, if the shoe fits, I implore you to check yourself and check it at the door. All right. So the two articles that I mentioned that I wanted to share with you are the most recent two that have come out about COVID-19. The first one that you see, the top, is a group of my colleagues where we looked at a cross-sectional analysis of factors associated with stress, burnout, and turnover in tension among healthcare workers during the COVID-19 pandemic in the United States. And then the second one is my colleague from University of Texas at Austin, Dr. Upshaw, and myself. We recently had this article accepted by the Journal of Applied Communication Research entitled "Centering Survival as Cultural Strategy: Black Newspapers' Cultural Descriptions of the Coronavirus Pandemic." So I'm just going to tell you just a little bit about the first one, and then I'm really going to focus more on the second one because I think it's more salient to our discussion for today. So this one about the cross-sectional analysis associated with stress, burnout, and turnover and tension has to do with healthcare workers in a particular hospital in Phoenix. And so in 2020, we noticed that healthcare workers faced the COVID-19 pandemic amidst other salient sociopolitical stressors. But the purpose of our study was to identify significant associations between healthcare worker outcomes and health, work, and pandemic-related factors. We also wanted to shed light on the unprecedented problems within the U.S. healthcare system's labor shortage and worker burnout. And we wanted to address the ongoing needs for institutions to attend to the health, well-being, and retention of workers, while at the same time we wanted to promote worker well-being for institutions to adapt to the ongoing pandemic and future health crises. So we started looking at this in 2020. We looked at quite a few individuals. In fact, there were 985 participants in this study. I won't go into it very long, and certainly you can read it, as I mentioned, that I don't think I told you where it was, but it was here. It is in the health and social care in the community, and it's an online article. The DOI is there. But we looked at community health workers. We saw also minoritized workers. Many of them are not just medical employees or medical workers, physicians, for example. Many of them were nurse practitioners. They were, some of them were social workers. Some of them were cultural health navigators who put their lives on the line to work with refugees, for example, to help them understand what they needed to know in their own language regarding COVID-19. And so we saw a variety of these different factors that also were associated with their work, their stress, and their burnout, and also the turnover, which we've seen throughout the country. But we looked specifically at a small, if you will, a small segment of the population that told us both in qualitative terms and quantitative terms about their experiences with burnout. So I mentioned the purpose of that study, but then the one that I really want to focus on more is this regarding the centering survival as cultural strategy. Black newspapers' cultural descriptions of the coronavirus pandemic. This idea of Black newspapers is something that isn't always known by people at large. And we have so few Black newspapers and newspaper companies and organizations around the country to this day. But Black newspapers have had a historical background here in the US. My relationship with the Black newspapers started off as a child, where my father would take me to the Los Angeles Sentinel. I grew up in Los Angeles, and the Los Angeles Sentinel is the Black newspaper for decades. It has been where you knew everything about who were the best doctors, what was happening in terms of the entertainment world, what was who were the hoity-toity people who were part of the Lynx, or they were in their sororities and their balls and their debutante balls and so forth. That was in the newspaper. And then also, as my father would always see it, because he was a burgeoning entrepreneur, he would look at real estate and where were some of the probates and where were some of the other opportunities for acquiring land. And he would look in there, and he would also put in the advertisements any land that he was selling. So I would always go with him every Tuesday afternoon after school. He would go and put an ad in. So the Sentinel became kind of like a very real place for me. And then later on, when I studied about the Tulsa Race Massacre, I went to the Oklahoma Eagle, which was one of the first Black newspapers owned by a Black family, the Goodwins. And they told me all about the history of the Oklahoma Eagle. They told me all about their family, and I've written a few articles related to that and related to the Black newspaper and the importance of the Black newspaper in a Black community. I wonder if any of you know what this is. It says the Phoenix Tribune, and it says August 8th, I believe that's 1918. August 8th, 1918. Well, that was the very first Black newspaper in Arizona. Isn't that something? Now, I had to Google, was or is there a Black newspaper in Flagstaff? And I'm sad to say, I didn't see anything that came up, and I have a feeling there is not. And now currently, and in fact, I do know the owners, the Arizona Informant, owned by the Campbell family in Phoenix, has been a very long-standing historical Black newspaper, and the family has owned it for many, many decades. The grandfather and great-grandfather, of course, have passed, but the contemporary family members still own the newspaper. I just wanted to point out to you, look at what they say here. Look at the headlines. Colored boys given rousing send-off. Let's see, what's another one? Drafted boys are shown every courtesy, all in high spirits. Colored people of Phoenix turn out en masse to bid farewell to our boys. So they're referring to the World War I. This was World War I, and Black soldiers were not accepted in the army, in any of the military. They were less than second-class citizens. But they wanted to be men too. They said, we are. We're not wanting to be, we are. And we want to fight for our country. We believe in the United States. And so this Phoenix Tribune, which was the very first Black newspaper in the state, right here in the state of Arizona, they wrote this. So much happiness and glee. German soldier diary tells of the ugly task, I think it says. Mob burns furniture to scare away tenants, I think it says. And so all of this is my point. I'm trying not to get away too far from my microphone, but hopefully you can read this. They are identifying what is important to the Black community, to give them a sense of community, to give them a sense of pride, to give them a sense of humanness, humanity, to give them a sense that there is some truth in their existence. There is a truth in the narrative of their lives. That's what the Black newspaper meant back a few centuries ago. This is, again, this is 1900s, early 1900s, but about 100 years ago. Yeah. Let's see, what's another one here? 154 Negroes, that's what we used to be called, and sometimes still are. In some circles. 154 Negro selectmen with grammar school education are called. Translators of Spanish wanted. Could that have been Black people knew how to speak Spanish? Yes. And they are, the Black newspaper has said, please, if you know how to speak Spanish, we need your translation. And again, this is a Southwest, so they probably had, interactions with Mexican individuals who spoke Spanish, so they needed that. Let's see. Negroes are in the Marine Band. The Marine in the Marne battle. I think that says that. Colored nurses to be used in army camps. Prescott boys are really doing things up there. General Pershing visits hospital, praises troops. Now that must have been probably Black troops, because there, all this is about the Black community. So they would be talking about Black troops. 50,000 Negroes are called to the colors. And I believe that's maritime colors or military colors. Again, when you have all of those accoutrements in your uniform, you have been recognized as a pretty doggone good soldier. Negro soldiers must be served, say officers. Yeah, so that's it, must be served. And it says all of this, yet the Negro is loyal. The Negro is loyal. So that notion, oftentimes that Black men were not seen as men in a masculine way, but they were loyal like a pet, like a little type creature that kind of stays around your ankle and your foot. You can pat, and then when you're done with it, you can say, shoo, get away, get away. I'll have none of you until I want to see you, and then you can do some service for me, and then, you can come out and I'll take a look at you for a minute, but then you got to go. And so this newspaper was to recognize the breadth and the depth of Black people's experiences and narratives and stories at this time in 1918 and beyond, specifically as it related to the Southwest, and even more specifically as it related to Arizona. Now, the article that I mentioned about Black newspapers that Upshaw and I did and just got it in press, the purpose of that was to examine the relationship between Black newspapers That's what I'm reading. And Black communities to reveal the role of cultural knowing in light of a global health crisis. So Upshaw and I thought it's really important to see if Black newspapers are that vibrant and that important to the Black community now as it was, 100 years ago, for example, as we're going through this health crisis of the pandemic. Our other purpose was to observe the role of trust of Black newspapers within the domains of health and wellness. Once again, that idea of trust. Do individuals, do community members, do readers really observe the role of trust of their Black newspapers when they read, or if they're part of their subscription? And then finally, our purpose was to explore the narratives involving health disparities and cultural trauma as familiar topics conveyed by Black newspapers. Dr. Evans spoke about trauma. Dr. Ward certainly talked about trauma. And I have felt the same thing often as I noticed, I felt very sensitive and close to Dr. Evans when she said, I'll get myself together. And it always happens right when you're in front of people and you are starting to talk, because I think all of our senses are open and free. And I like to think that the ancestors we're talking about are in the room. That's what I think. And sometimes I didn't do it today with all of you, but sometimes I have my audience members speak a name of a person who has passed. And I believe that when you speak their name, they're here. You've invited them back. We can't see them. Probably if we saw them, we'd be running out the door. But we have invited them. And when we invite them in, that energy of really connecting with them is it's like right on top of our nerves, our sensibilities. And sometimes it gets you choked up a bit. But yet we have to be professionals, and we're trying to hold it together, as Dr. Evans so eloquently did earlier today. But yes, that idea of cultural trauma means that even though you weren't there, I wasn't there 100 years ago in Tulsa, but I know I didn't have a chance to know my relatives. I know that my father was still ready to cry at whatever age he was, 60 or 70, I think at the time, when I started talking to him about his father. And, it's just like right there. It's not like deep inside, it's like right there. And you can start, hysterically crying because the trauma is so real. What is known about this topic of Black newspapers and their role in the Black community? Well, we know that Black newspapers historically have been the conduit for procuring, tailoring, and disseminating information to Black communities. Some of my work recognizes that, and a colleague by the name of Wilson in 2014 also speaks of that. Also, this one down here. Black newspapers are crucial information resources in disseminating culturally tailored information. And I know that we spoke about culturally tailored information earlier. I heard it mentioned, I think Ann Carver and Dr. Evans talked about that. And I was really happy to hear them mention it, because culturally tailored information means you have to be sensitive to the culture of whom you are speaking and of whom you have decided you're going to tailor messages or persuasive advertisement, which we find oftentimes in newspapers. We also feel that Black newspapers understand what the Black community wants. And so it's oftentimes those individuals who want to come in and decide what the community wants or needs. And then, of course, that is when you have that severance, or you have destroyed the the trust that readership might have with the Black newspaper, because readers know when you're being disingenuous. Just as I said before, truth cannot live with a lie, and a lie has to go, or the truth has to go. But they just can't operate together. And so readership also knows, Black newspapers around the country have really worked hard to keep that relationship with their readers. And then this, Black newspapers reflect the lived Black experience. That's that title again, and highlight community engaged coalition building efforts among Black Americans. And so once again, this idea of the Black experience also means, how do we coalition? How do we create building opportunities that we understand about health concerns? We understand about how we navigate some of the legal issues of our community, or a variety of, education. How do we understand real estate, for example, land ownership? So there's so much that we know already about this topic of Black newspapers. Our research questions emanated out of what we felt may have been the gaps in the area of Black newspaper and understanding of Black newspapers. So our first research question was, what emerging descriptors occur in the purposely selected Black newspapers concerning COVID-19? We, Sean is his name, Sean Upshaw and I looked at several newspapers, and we call them purposely selected because we had gone through several of them, and then we selected them based on what they said, based on where they were in the country, and we came up with 3, which I'll share with you in just a minute. And then our second research question is, how and to what extent do the purposely selected Black newspapers promote proactive engagement to their readers about COVID-19 prevention? So there's a little bit to read here. I'm sorry about that. I wanted to give you pictures, and I wasn't able to download some of our figures for you, but I do hope that you will think about looking at this. In about 2 months, it will be online with the Journal of Applied Communication Research. But we employed a qualitative content analysis to explore COVID-19 news coverage from 3 purposely selected Black newspapers. And we paid attention to the descriptions of cultural importance and psychosocial implications of COVID-19 and the promotion of mitigating strategies for navigating the pandemic. In other words, what were the newspapers saying about COVID-19? That's all scholarly language to just say. The Black newspapers wanted to say, hey, folks, you all need to know what's happening. But you can't say that and get your article published in an academic journal. Our study reveals 3 selected newspapers describing Black Americans' health and racial disparities related to the pandemic. So we looked at the Louisiana Weekly, the Los Angeles Sentinel. I really felt that the Los Angeles Sentinel was good, and Sean thought so too. And the Philadelphia Tribune from February 2020 to April 2021. So it was right in that sweet spot of everything going chaotic about the coronavirus. And we looked at those 3, and we were examined on how they interpreted and promoted prevention strategies through culturally tailored reporting. We also felt that our study demonstrated how each newspaper centered vaccination and testing as a form of community resilience to COVID-19. And then our study also looked at results that suggest Black newspapers should be considered crucial information resources for disseminating culturally tailored information among Black Americans. We tried to really kind of broaden the scope of Black newspapers and how important they are during this, challenging time of global pandemic. So our exploration looked at how Black newspapers offer the mitigating strategies, as I mentioned earlier, as a form of survival. We found that there were cultural touch points that were noted in each of these 3 purposely selected newspapers, such as religious beliefs, skepticism toward white doctors can shape health attitudes, such as cancer screenings. We saw issues around prostate cancer. And when I say issues, I mean various cultural touch points that you could read various columns that suggested, being careful, being watchful. These are the things you need to ask the doctor if you go to a physician. And it was all very culturally touched upon. And we felt that that was one of the themes that emerged out of that idea. Perception also, as we look through each of them, perception means the component in the effectiveness of health information in activating health promotion behaviors. Black newspapers as a potential tool to address health inequities and attitudes, even about obesity, we saw that. So that idea was perception is that the reader perceives that there is effective health information that's being given in the newspaper. It's all a part of idea of trust. If the reader believes or perceives that the newspaper cares about them and their community, they're going to listen. They're going to maybe stop and go, maybe I should take that vaccine. We also saw that recommendation messages were found in Black newspapers that recommended the best course of action by an authoritative figure or leadership body in the Black community. So where they may have been skeptical of a white doctor or physician or clinician, the recommendation messages of the Black newspaper helped them to see that they could believe the best course of action because this was an authoritative figure. We saw the coverage of cancer was a familiar story in Black newspapers, also as Cohen and their team saw in 2008. But studies show that Black newspapers are reliable sources of culturally centered cancer education and persuasion concerning decision-making and self-efficacy when stories feature Black Americans in cancer survivorship. Some of my work, I mentioned that. And I mentioned earlier that I've done some work with the Coalition of Blacks Against Breast Cancer, an organization in Phoenix. It's really a support group for Black women and also Black men. Men do have breast cancer as well, but because it's oftentimes gendered, we oftentimes think that only women get cancer, breast cancer. So sometimes men who get it, they don't want anyone to know that it's breast cancer because they are embarrassed that, that it's not a masculine thing to have breast cancer. But we have found that Black newspapers, when they cover something like cancer, again, those stories are reliable sources for cancer education, for individuals to say, I will believe this because I see it in our newspaper. And then there's cultural motivation of Black newspapers providing cultural cues that promote risk avoidance in health behaviors and also in disease self-management by Black readers. There was an article from Lumpkins and their team in 2010 that found Black newspapers provided information as a form of media advocacy for health disparities in healthcare. That idea of the way the media can advocate for its readers by placing information there to give cultural motivation to be sure to be careful, to promote the avoidance of risks. And that's also very important. Moving right along, the method here is we use the qualitative content analysis that again helps to analyze and interpret the meaning of new stories. We looked at the thick description we talk about in scholarship about the thick description of an experience or a phenomenon of a collective group. How have they described their experience? That's very rich data. And it gives, the thick description gives readers a sense of the emotions and thoughts and perceptions about research participants, how individuals who have those stories of cancer, for example, what do they think? How do they perceive? What's their experience? And it helps the readers or readership to deal with the meaning and the interpretation, and also what their intentions are, what the person's story is intended to do, but also how they are to embrace it and accept it. Our method also helped us analyze the data set through different phases of this qualitative content analysis, and that's through preparation, organization, and reporting. And we did all of our different phases of content analysis, and resulted in themes that emerged out of the construction of narrative description of this phenomenon of Black newspapers and how they present COVID-19. Our results include that we saw these themes. These were the themes now that came out of our study. COVID-19 is an extension of existing health disparities. We've heard that already this morning, of how the health disparities has not just arisen, it's because oftentimes what has happened to the Black communities because there were health disparities before, and they have now exacerbated as a result of COVID-19. But Black newspapers describe this as a health disparity that affects diagnosis and death among Black Americans. Again, this idea of health disparities. And that COVID-19 was an extension of what has already been there in health disparities. Another theme that arose was COVID-19 recalls racial trauma for Black Americans, referring to the way that the readers or the Black newspapers brought attention to their readership to the prevalence of racial trauma, such as events that occurred with Hurricane Katrina or the Tuskegee syphilis study. And again, the way it's painful, but as readers read, they believe they would not hear these things in a white newspaper. And they need to have, as painful as it is, to be recognized about the cultural trauma. So they turn to their Black newspapers to do that, and they trust their Black newspapers. We also had a couple of other themes: COVID-19 testing and vaccination as community resiliency. Black newspapers focus attention on health promotion to Black Americans as a form of proactive engagement through the concept of community resiliency. This notion of community resiliency means the ability for an individual, group, or community to thrive despite the presence of social or environmental obstacles. And that idea of community resiliency is also deeply embedded in each of the three newspapers that we looked at. There's always a hope, but also make sure you have this ability to thrive, even though things are going this way. And this is how you can thrive. We also looked at another aspect of methodology, which is called second level agenda setting, which revealed how Black newspapers underline and centered the uncertainty and anxiety about testing and vaccination by encouraging readers to understand the circumstances, benefits, and rationale to reduce the spread of COVID-19. So this notion of second level agenda setting means the newspapers said, in addition to just giving them the information, we want to also address their uncertainty about anxiety, and we need to, we just need to blow it out of the water. We need to just lay it out there for them to be able to see clearly what are the circumstances, benefits, rationale with regard to reducing the spread of COVID-19. And then I'm nearly done here, a couple more slides. I wanted you to just get a little bit of a feel of what some of the narrative comments were in each of the three newspapers that we looked at. In the Los Angeles Sentinel, one column said this, written by Harvey, one of the reporters: "Trust is sacred, and it hangs by a thread between the Black community and some of our institutions. The church has always been the bridge to engage the Black community, rebuilding the trust that has been broken," said the Reverend Gerald Agee, founder and pastor of Friendship Christian Church. "We urge those in our community to get tested. It is one, sorry, I spelled that wrong. It is one way to help keep you and those you live with safe," Agee continued. So again, this is one of the quotes in a larger article that Harvey wrote about the importance of getting vaccinated, out of the Los Angeles Sentinel. In the Louisiana Weekly, something similar. And I quote, "We want to encourage the African-American community to be part of the vaccine testing," says Dr. Redfield. "If the African-American community doesn't take part in the research, we won't have experience in this community that will reinforce the safety and efficacy for the future public," end quote. And that was a column also in the Louisiana Weekly during the course of the time that Upshaw and I looked at that. Again, that those quotes from legitimate individuals who were seen as those trailblazers, as those important persons to listen to in the community. And then finally, the Philadelphia Tribune, this quote came from a news story that Jones wrote in 2021, and I quote, "Get a mask and wear it. Get the test and get the vaccine. We are encouraging people to take this fight to stop the virus. We can win on this thing. We don't need to lose so many people in sickness. We are trying to empower ourselves, trying to empower folks in our community, leaders in our community, to communicate the message of stopping the virus," end quote. And that is the Philadelphia Tribune, a news story written by Jones in 2021. So I hope you can see with this, at least with a little taste of what those three newspapers identified, their readership of Black people are listening and have listened. And we were looking, Upshaw and I, at how impactful are Black newspapers still in the community of Black individuals, specifically as it relates to the global pandemic, and being vaccine hesitant, but maybe just a bit, readership is moving toward being more willing to take the vaccine, not be as vaccine hesitant because they have read it in support of it in Black newspapers. And I think that is all for me. Thank you so much. Thank you.
Thank you so much, Dr. Davis. One more hand for Dr. Davis. Beautiful. And now I know we're nearing the end of our time, but we've covered a bunch of content today. And I want to make sure I give everyone the opportunity to ask questions, because I know you folks have been just chomping at the bit to ask questions of all of these different experts in their respective fields. So we'll go ahead and transition to that very last part. We'll ask our panelists to please join us, which will be all of our speakers, plus one more speaker who I'll have the honor of introducing. And then I'll grab the chairs because I need to grab 2 more chairs to bring up there. And then please, in this last bit, any questions, comments, thoughts, perspectives that you might have, this is a wonderful opportunity for us to really expand on all of the content that we've actually had today. So in addition to our different speakers that have presented throughout the day, we're also joined by Amber Jones. Amber Jones is actually the vice chair of the African Diaspora Advisory Council and is also a research coordinator at the Pathogen and Microbiome Institute at Northern Arizona University, where she heads the genetic sequencing core. She received her undergraduate degree in biomedical sciences with a chemistry minor and her master's in sciences and biology at NAU Go Lumberjacks. She has worked in research and development for over a decade and has a focus in genetics and molecular biology. And she's also currently working to become a Coconino County Master Gardener, fun fact. When she's not engaging in research or her beloved community, she loves to spend time on her little urban farm with her daughters, husband, 2 dogs, ducks, and chickens. So welcome me and joining again our speakers and esteemed panelists to the floor. And please get ready to answer or ask whatever questions you might want. Oh, okay, cool. Yeah, sure. So I've got questions here that I've prepped, but I know you folks in the room probably have questions and I'd rather prioritize those. Perfect, so please.
Thank you so much. Hi, everyone. My name is Kim Robinson. And I have a question in general. Several of you spoke about deaths in the Black community of the coronavirus. And I haven't seen many studies addressing if a medical examiner came to a conclusion based on geography, ethnicity, or economics. Have y'all seen any disparity with the diagnosis or the determination that someone died of coronavirus as opposed to with coronavirus?
I don't sound so excited.
No, it's a good question, but I'm sighing because in pulling some materials for this talk, I do remember just seeing an article that just recently came up that was saying that they were trying to estimate the undercount of death. And it was a huge gap between the numbers that are reported and the numbers that they believe are actually true to be, because of all of these other things that are tied to COVID. I will look and try to find that for you. But I think it's a bigger question because it's not just about like having COVID and the attribution of death being tied to COVID. There are all these other complicating factors that I think with regards to stress that cause that wear and tear on the body that will not actually manifest until much later. So I think that even an estimate like that isn't probably true. No.
All right, thank you so much. Other questions from the room at all? Oh, sure.
All of the presentations have been wonderful.
Awesome. Great. Questions? Oh, sure.
I want to wait till the panel assembled. Dr. Davis, you speak of self-care, especially with Black women, and self-care it's different in different populations because Black women, we are supposed to be the super women. We have this, you do everything. If we cry, we're weak. If we break down, we're weak. Have you noticed in your studies any resistance or opposition to your campaign for self-care, especially in the Black community, when we've been told for so long, you need to be resilient, mental health is taboo. If you have that crazy uncle, he's just back in the back room. Have you had that opposition to your message?
That's a very good question. You've got all these good questions this afternoon. Well, actually, is it Kim, right? Yes. No, I have not seen a resistance from Black women. In fact, just quite the contrary. Black women, and many of whom, they're my colleagues around the country, who are, I don't want to say dying to get out, but they are chomping at the bit to get together and to go somewhere for self-care. So for example, one of my colleagues out of Missouri, out of St. Louis, does some consulting in self-care, has written a book on self-care. And she and another colleague are trying to bring professors, Black women professors together to go away somewhere. I encourage them to go to Sedona. But I know you were saying about not going out on the nails and the manicuring and so forth. But I suggested to them to bring in the Black and African rituals, to make this a ritualistic experience of coming together and healing from within, healing those very painful parts of our experiences where we have been told, you do all that so well, so all the students can go to you. That's free labor that Dr. Ward talked about earlier, free labor that we oftentimes do for our universities, our departments, labor that is not tabulated, but we are the ones who get maybe all the Black students who will come to us or expected to go to us. And what happens when you need something to build up after you have been so spent in giving and giving and giving and giving. So I find that self-care from at least the circle of women who I've heard about around the country, they're trying to replenish themselves. And again, it's still replenishing ourselves to give again. They never stop giving. And I think that's the thing about Black women too. We just give and we give and we give and we hope and we hope, and sometimes at our own expense. But this new movement, shall I call it a movement of self-care, to me seems to suggest that Black women are saying, yes, we do give, but we also have to take care of number one before we expend everything, including our own health. So no, I have not seen that. I don't know if my other colleagues have.
Yeah, I'd be interested in hearing from Dr. Ward. You also talked pretty thoroughly about self-care.
Well, yeah, well, actually, I think I mentioned the the Black Women Thriving Project. That was a survey. We surveyed over 2,000 Black women across the country, mostly professional women. So we actually had a similar demographic as the in-state sample. And a few things, we had the survey, and then we also did 17 focus groups. And what we found was it was very hard when asked the question, are you thriving? The answer is always no. And what does it look like to thrive? We asked it in a whole host of ways. And it was very difficult for focus group participants to even think about what an environment of thriving could look like, because you're constantly in the mode of survival. But one of the consistent themes of the conversation was around diversity work, and that Black women just do not have interest in serving as diversity agents for their organizations, but they do have interest in things like affinity groups and spaces where Black folks can come together, or folks of any historically marginalized group can come together and find solace and support and care amongst each other on the dime of the organization. And I say that because this is a form of investment, right? So if organizations are about investing in climates of care, we talked about the rhetoric of communities of care at ASU. If they're invested in that, they have to show and prove, which means you've got to create the conditions for historically marginalized groups to come together, to be in community, not for the purpose of showing how diverse you are as an organization, but for the purpose of caring for your workforce so that you can retain them and they don't leave.
Thank you so much, Doctor. Yeah.
I was going to say that's like when I went to school all those years ago. It's like, why do all the Black kids sit together in the cafeteria? Well, we sit together in the cafeteria because that's where we find community. And so I was just going to add that for some people, or for all of us, self-care is going to look very different. And so we might have to just be aware of that. And so how you take care of yourself is not the same way that I might take care of myself. And so sometimes this is for you all, don't hear this, but sometimes we want to criticize us for doing what's right for us. And what feels good for us. And so I think that just as women of color, and especially when we're trying to support one another, that we do have to remember to just be supportive of that different self-care. That, that's just something, because I'm looking to you for support. And if you say, oh, Deb, why are you doing that? That's not self-care. You should go get a massage. I don't particularly want people rubbing on me. So, no, I'm not going to get a massage, but I'm going to sit and have tea with you if you want to do that and talk for 2 hours. And that's self-care. So.
Thank you so much. I actually have, oh yeah, please. Yeah, sure, online question.
And this question is from Jane online. I appreciate all of the perspectives shared here today. There was some really good discussion about getting COVID information from a trusted medical person with whom one has a relationship. I am hearing of some issues of vaccine accessibility, but also I'm wondering what your thoughts are about the role of informed consent versus forced administration of the vaccine, especially in light of the history of abuse and experimentation on Black women's bodies.
There we go. That's what I was looking for. All right. Turning up the heat. Who wants to go first? Yeah, especially in incarcerated communities. Yeah.
So, and I'm trying to remember because when you talked about athletes, artists and athletes, I was thinking of the Kyrie Irving controversy.
Yeah, sure.
And, you know, coming out of African American studies, we have we're very familiar with the discourse of the Hotep and the sort of idea of a kind of performance of a connection to a version of Afrocentricity that is quite male dominated, often very articulate in their transgression of predominantly white institutional workings. And I think that there's, you know, when the sort of public service campaign to get folks vaccinated emerged, part of that kind of Hotep web presence, you would find lots of rhetoric about that in my opinion, there's a fine line between that kind of that version of an anti-vax discourse and the version of an anti-vax discourse that I think most Americans are familiar with, that emerged out of the populist alt-right movement. But the challenge is, going back to that concept that you posed earlier, that it's really hard to hate on their criticisms. It's really hard to not ask yourself, maybe there's a point. And I actually have a significant number of family members who are in kind of frontline medical service work. And one of my cousins, he was like, I don't like to say this out loud, but I got the first dose and I had such a hard reaction to it that I just refused to get the second dose. And I know many Black physicians who have refused to get the vaccine. And so I do think we have to create spaces in our society for folks to talk honestly about resistance. And just because someone says that they're not vaccinated doesn't mean the rationales are the same across communities, and that we should harshly judge folks in that way.
I'll just add on with so coming from like the scientific community, you know, developing the vaccines, I feel like a lot of the people in that field are very much like, it's safe, you should take it, just take it. And I think they're very much the ones pushing back on how, like, opening up those spaces to have conversations. And I've had conversations with family members who feel very differently. But I think the scientific community also doesn't understand the historical context. And I think it goes back to one of the slides saying that they haven't acknowledged what has happened. And so I think that community building and communication is empirical. So people do have the information that they need in order to make informed consent. Because it's all very new. It happened very quickly. And it was very terrifying at moments. You know, we're losing family members and friends left and right. They have this new vaccine that they're saying is, you know, very different from the other ones and it'll work, just take it. But how do you get informed consent when you're stressed out and you're not getting the information that you need to answer your questions?
You know, I think this brings the point of the notion of informed consent and learning more about what informed consent means. I think a lot of our community members don't understand that. And even in my own family, there's a fear of taking the vaccine. I have some family members who have adamantly, like, you know, ready to throw down. I'm not taking it. And, you know, if you want to do it and you and your family, fine, but we're not taking it over here. But I do think that there may be some need that we have to teach more about what informed consent means. I'm thinking now about Henrietta Lacks. I'm thinking about, you know, a variety of Tuskegee syphilis study, and all of those. Of course, there weren't informed consent during slavery period when Black women's bodies were used for medical experimentation. But I think there's a need for education about what an informed consent means. I've worked with some medical professionals in the community down in the valley. And they are always they're Black physicians encouraging Black community members to be donors, donors of their, organ donors, thank you. And most of the community goes on no. And I think they say that because if you think that, just say, for example, this may not happen, but I think the fear is, say, for example, you're in an accident and you might go to the hospital to get, maybe your life to be saved. But because you might have a spleen or a liver or eyes that could fit someone who needs, I've heard relatives say, well, then they just might say, time for you to go. You've been here long enough and we need those eyes, or we need that liver. So, we'll call in someone to give you your last rites, but you're done. And so I don't know if that would happen, but I believe the fear is there. And so this idea of informed consent, what are we informing about? What are we consenting to or not consenting to? And what are the ramifications of it? Just basically education. More education needs to be done with our Black community around informed consent.
I mean, damn, I wasn't scared of that before, but I am now. So.
I think that we should think about consent even broader. We all gave up a lot of saliva over the past couple of years. And if you pay attention up front, there, in some cases, are boxes about whether or not that can be used for other purposes. And so I think that that's something that that isn't always recognized. It's not widely advertised. And that's a real concern.
Sorry, I don't want to belabor this, but some of you might know, and I'm rather embarrassed about it because it had to do with some of us who are here from ASU. You might know about this, Mako. Here in, I believe it was Navajo country, you might know about ASU several years ago in the early 90s that really had a breach with community members who were in the indigenous communities.
Havasupai, yeah.
Yes, the Havasupai. And they did not have the consent to use, I think it was the saliva or blood for other aspects of what they wanted to test. Each test you decide to take, you have to get informed consent. And they didn't. And there was, I think, a young woman who was going to law school who was of the community, and she found out about it and it blew up. I mean, and so now it's a prototype. It's one of those type of studies and stories that everyone knows about in methodology courses and ethics courses. You do not do this. But it happened right here in the Havasupai community, right here in Arizona. So, and with Arizona State University. Of course, since then, the IRB, the Institutional Review Board of ASU, was totally transformed and really has more bite to it, and being cautious about all of what goes into consent. But I do agree with you as well. We oftentimes do not realize the importance of our community members knowing what are you signing and what aren't you signing, and what are you signing away. I personally was uncomfortable about sharing my saliva with my employer, and I was called on the carpet. I was called by my superiors because this is early on in COVID, and they would send an email that would say, you've been selected. You've been selected, and if you don't apply,
which is so ominous, right?
Yes,
like,
you've been
what?
selected. And if you don't respond, then they shut down your email. And, I live for my email. I got to answer things and, so forth. And I had to speak to the vice provost of faculty affairs, I think was her title. She said, so what's up, Olga? What's, and I said, well, there's nothing up. It's just, I want to know what And I didn't back down. And she said, well, you know, do you have a problem with it? And I said, well, yeah, don't you? And it was, you know, so I did, you know, I think I spoke truth to power, but I was ready to go for it because I felt it was an ethical consideration. I really did not feel, knowing that my saliva also holds my genetic code of all these young people or whomever will come after me years after I leave from here, all those people, if the world is still here. And I didn't want to just give that up willy-nilly, just with my saliva. So I got the, what would you call it? I got the dispensation not to do it. And to this day, I have not used I don't use the spit. When I get checked, I go to get the nasal check. And maybe I'm too persnickety about it, but I just feel, for me, it's an ethical issue that I'm concerned about my saliva and where it might go.
Absolutely. Thanks for sharing that. So I have a question. You know, so we've talked about all kinds of different things today. We've talked about redefining, you know, health disparities from a framework of, you know, social environment and factors and policy and, you know, institutionalized racism. You know, we've talked about, you know, all of the different groundwork and contributions to Black stress in the lived experience that also exacerbates health outcomes in our experiences and perceptions, the way we interact with the healthcare field. I know, you know, being here locally and being so involved with testing efforts and initiatives here, some of the skepticism and fear that surrounded, you know, this last bout and fight with COVID-19. So my question for all of you on the panel is, what do you feel the groundwork is that needs to be done, you know, before the next monkeypox outbreak or who knows what, to make sure that we actually have tangible changes happen in policy? You know, what does that look like to take it from, you know, the preaching to the choir to making the folks with the decision-making power make changes? Easy, light question. So whatever, you know, a couple bullet points with you.
I always go back to communication. And what I mean by that is there has to be an understanding, a clarity of knowing what is happening within the community. The community has to know before it embraces a policy, or if there are others that are going to argue for a policy, the knowledge of what that means and what are the ramifications of it. If we go this way, what are the implications? What are we gaining? What are we losing? All the critical thinking aspects of what that is. I think that I still don't see that.
Yeah.
I still see that it's more like, well, we don't really know, but maybe we should, maybe we shouldn't. These relatives aren't taking it. We won't see them at Christmas time,
Yeah.
and, you know, back and forth. So I do think that that's one of the foundational issues that still needs to be done.
Totally. And, you know, that's what we've had that discussion in some of our Live Black experience conversations around, you know, before we were completely desegregated in Flagstaff and, you know, assimilated, if you want to use that term, into the community, we had this centralized community of Black people in the South Side, kind of all in one central location, which obviously has a lot to do with disenfranchisement, but it made it a lot easier to kind of get on the same page and work on how we're going to communicate with our, you know, with our people, right? And now that we're so spread out and things are so online, I wonder, is it possible to effectively communicate with such a mass of people spread out across such a wide, you know, landmass who are having these similar experiences of disenfranchisement and oppression? You know, what does that look like in the modern 21st century? But first, don't answer that question yet, because that's a totally different question. Let's keep going on the question of what you folks feel like on the things that the fields you've presented on, the different research you've presented on, talking about redefining or shifting the paradigm of how we actually talk about health disparities. How do we make the people in power change policy to reflect that in your mind?
They need to know what communities are saying. I was just thinking, as you mentioned, that that we're going to be, we at ASU, several departments are coming together to do a Black Men's Health Forum in be either mid to late November, probably not late because that's Thanksgiving, but somewhere in November of 2022. And this town hall hopefully will be such that it will be online and be like a webinar. And I believe we're going to have it open to those who would like to come. So it's community men, it's men who are in the fraternities. We're really trying to speak to young men to come and also understand health issues. And then also to hear them. What are the issues pertinent to Black men in this particular forum? That is a town hall issue. Town hall means we all come together and talk about the salient issues that are pertinent to us, but also that are could be debilitating to us moving forward. So a town hall meeting or a continuous annual or biannual town hall meetings might be the way.
Mhm.
And then for those who are in an upper administration or power position, they have to also be educated to understanding why this is important for them to hear, and then hopefully act on it.
Well, I would argue that because Arizona is a minority state.
Yeah.
And one of the things that I don't think we do well here is coalitional work amongst BIPOC communities. And, you know, I think policymakers respond to big data and they respond to patterns across a large swath of the demographic. So in a state like Arizona, when you talk about issues very specific to the Black community, it's very easy for politicians to tune out because our demographic is so low. And I think if there was better network and communication amongst and in solidarity with other BIPOC communities, I think someone made the point earlier that as things are impacted in our community, they're also, they may be situated differently, but the overall outcomes are similar. Right. And I would like to see more of a network among Latinx, Indigenous, but in order to do that, we also have to create the conditions for better understanding of the specificities of our respective communities, right? So what does it look like for, you were talking earlier about doing focus groups with our colleague, Matt Ignacio, and doing focus groups with Indigenous community. What does it look like for folks to be in dialogue and conversation and develop that deeper relationship and understanding of how different our communities are in order to get to the place of political coalition? You can't start with political coalition if there's not a willingness to acknowledge and recognize the difference and be vulnerable to learn and grow and build those relationships.
I really like that answer. Yeah.
The question is, what do we do if there's a feeling of economics, like you're taking away money? If one group may say you're taking money or resources from me or from us, so we don't want to. I know it's completely antithetical to coalition building, which I embrace, but the dollar is oftentimes that tension that comes there. If we build with you, then that's going to take away from us.
Right. And of course, the response to that is, you build with us, it grows your base, right? You benefit, we all benefit. And I think for far too long, our respective communities have operated from a deficit model, meaning we have to be about me and mine. Yeah. But in a place like Arizona, that doesn't work for Black folks. Right. That might work in California, that might work in Texas, that might work in New York. That does not work here because there's not enough of us.
So I kind of have a follow-up question to that, Dr. Ward. And, how do you do that when you are, marginalized among the coalition members? Yeah. I mean, the other minoritized groups. I mean, how do you do that?
So I'm going to give a really
That's
specific
a great
example.
it's fine, yeah.
I'm going to give her, because the first reaction is you just consistently show up all the time. But I'm going to give a specific example. And it's not about health. It really is about kind of racial equity work. I think the way that predominantly white institutions function is, okay, this year it's going to be your community. But
Yes.
then when that academic year ends,
Fiscal year's over now.
now we're moving on, right? So I think for the academic year of 2020 to 2021, it's all about Black faculty, staff, and students, Black
Mhm.
Lives Matter. Everybody was about Black Lives Matter. By the end of that academic year, there were changes, really intensive changes and financial investments, all good. But then it became we're at HSI, we're moving on. And so I think the challenge is how do we get institutions to be more expansive with, you can do the both and. You can
Mhm.
be about Black folks and Latino folks all at
Yeah.
the same time. You don't have to have like separate calendar years. But to your specific question, what I find the most disheartening is that I am part of a collective of Black women faculty. We show up to everything for every group. But when it comes to our stuff, not everybody our folks show up. And I think part of it starts with are we showing up for each other with our respective issues, concerns, and movement work? But then two, and this is the harder part, how do we engage? And because I'm a Black woman, I'm going to talk about anti-Blackness. How do we begin to have frank conversations about what anti-Blackness looks like in non-white communities across the state of Arizona? That has been a very difficult set of conversations to have with people. Like the year of Black Lives Matter was a lot easier. It's like, I think I know what anti-Blackness is now. Now we're going to talk about anti-Blackness as it emerges in reservation communities. Now we're going to talk about anti-Blackness as it emerges in Latino communities. And it's very difficult to do that. It's also difficult to acknowledge that in our community, there's a lot of prejudice. There's a lot of misinformation about other communities of color. But I always go back to that is the conditions of structural racism, that we are constantly put in opposition like crabs in a barrel to fight with each other instead of fighting alongside each other, directed towards the right enemy, so to speak.
Yeah, and like when you operate progress from this model of like capitalistic competition, right? Like there's a finite amount of resources. And so we've got to compete for these finite amount of resources as if we were businesses in an industry as opposed to a marginalized group of human beings. It lends so much competition and vitriol against each other, and it ends up being a cop-out for the people with the resources who we need to hold accountable because we're so busy competing. So, I'm always going to shoe in my anti-capitalism, social justice thing in there, but please, it's designed that way, Yeah, it is designed that way. Yeah. For competitiveness, right.
So there were a couple things I wanted to share. I think that, so one of the challenges that I've had, being, kind of the token Black person to engage the Black community on behalf of this huge NIH seal for university, for universities, Mayo, thing. And here I am, a PhD student, right? I don't even tell you what I get paid. And, responsible for really getting this message right with the Black community and on COVID-19 and contributing to publishing and whatnot. It's all good. It's not free labor, but well, it's something. But at any rate, I get to be here with all of you, and this is reaffirming and restorative in and of itself. Just like Miss Deb had mentioned, this fills me, right? So I'm going to do it. And so did the research. But the hard part now is to then take what we know, take what's now in transcripts and
The evidence.
the evidence of the
yes.
data, take the data
Mhm.
and get those decision makers to actually even take it seriously.
Right.
So that is the
Mhm.
difficulty, because what we garnered were a lot of community-based creative ideas on how to message health promotion, right? Protective actions, promotive actions to the community. And it feels like that alone, even though this is what I was asked to do, to actually get them to hear it is a fight.
Yeah.
And you know what? After hearing of so much loss or whatever, look, I needed to restore a little bit. So I didn't have that fight. I mean, I pushed back a little bit, but so that's an issue. And then getting them to take action. Okay, so not even just to listen, but then to take action on it is like, I feel like I kind of, to be honest, I had to give up on that. I was like, let me just use what tools I have, the pens, my pen, the manuscript, my, new
SPSS.
yeah, well, yeah. And my new, community networks to share what I know. And I can't depend on, the institution,
To
so
care.
it's institutions to do it
Right.
and to take it seriously. So it's that piece. So even when you gather it, to really even, and not look at it and not judge the stories, because what I hear from, oh, you heard, I mean, you might see this well, let me just say, what I hear from, the non-Black community is that, why are Black, even after this, why are Black people still, it's wait and see. They just want to wait and see. Well, if they don't want to hear, even though it's been said, about the earned caution, and that in fact, that is armor. That is the protective being of the Black community. Say, I will, before I start as a faith leader, before I start as a community leader, I need to figure out where you at and who you are and what you're doing. And I need to learn for myself that this is not another Tuskegee. This is not another, other, unethical approach. And to that is caring for yourself and others. That is self-care. That is care of the people and of that you're connected to. And so it still doesn't quite resonate. And I don't know how to do that I don't know how to do it. So that's a hard part. So when we think about that, I think we have to, so what I would say is, I think we need to continue to tell our stories and continue to tell the counter narrative to what we hear about us, and continue to share and whether it reaches the masses or only goes as far as the Black newspapers. We have to feel good about being able to share what we have. So that's a big piece. So that's a struggle. And one more point I want to make is, after hearing about, 74% of the people we talked to, Black people we talked to, were women. And the toll on mothers, aunts, daughters, grandmothers, I mean, is we can't, it's hard. I mean, we're going to have to just we'll see in time, what that looks like, but it's extraordinary. So with that, I also hear greater openness of Black women searching mental health solutions.
Mhm.
And I just think that's kind of that next era. Like we need to, and I also hear that there's not enough, like
Yeah.
there's not enough, Black therapists, and they're becoming networked, but they're kind of a commodity right now because their doors, their offices or Zoom or whatnot are full. So I just think the challenge is going to be how to tend to, whether it's self-care, restorative care. I mean, our responsibilities as mothers, whether we're aunties or whatnot, or daughters, our responsibility of mothering hasn't gone anywhere.
Mhm.
So what can we do to replenish? And that, I think, is where I think we need to focus. And I don't know what that means to
Yeah.
those people, to the people in power, if you will, but if we can receive more funding
Yeah.
to support these networks of health, these outlets of health,
Mhm.
these research on health, that I think is a beginning.
Yeah, because you got to make sure the infrastructure is there, right? Maybe you have the answer. Do you have the
I
answer?
do not
Oh,
have the
okay.
answer. And in fact, I'm going to give you a very, this is not going to be satisfying in any way, shape, or form. But I want to pick up on something that you said. It's disheartening to know that we're probably going to put this out there and it's just going to be there, right? But I think the one thing that I keep returning to is it is a part of the historical record. And if you don't write it, it's not there, and it's easy to deny that it existed. So
James Baldwin called us to be a witness.
yes,
At the very least, it's opportunities to be a witness.
yeah.
So
But you know what we're not doing? This is something I teach when I teach my graduate methods courses, is when we get to the conversations about epistemology, how we know what we know, and how we ask how we frame research questions. Oftentimes, we come to the academy seeking to better understand that which we already know to be true about our communities. But what we don't often do is turn back to systems of power and ask questions from a very rudimentary point of view about the nature of power and the nature of erasure. So we could spend our entire careers mapping the social disparities of our communities, but we don't devote enough time thinking through research questions that force us to have to put the spotlight on the majority. So how do we begin? And I'm thinking about the pause that I think often with scholars of color don't do. We go from project to project to project, and we don't stop and care for ourselves, especially when we do work that's very traumatic. But also, and I mentioned this earlier, I think he's a historian and education scholar, Andre Perry. He's at the Brookings Institution, recently published a book called Know Your Price. And in the book, he makes the argument about social scientists need to move away from exploring deficits in Black communities to reframing them as assets. And we need to be more creative with how we ask research questions that reframe Black life, urban life in particular, from the perspective of assets that advantage Black communities. And we need to spend more time studying systems of power and putting the onus back on those systems. So how do we create knowledge that asks a rudimentary question such as, why is it that politicians don't pay attention to these communities? Instead of trying to make good on or legitimize communities, why don't we? And I saw this emerging in the early 2000s with the rise of critical whiteness studies. And then it kind of fizzled out. But I think this resurgence of critical race theory has energized, at least I've seen this with colleagues, has energized folks to begin to move away from looking at disparities to looking at systems of advantage and privilege. And when we begin to spotlight how privilege operates or how white supremacy really functions in the day-to-day, it takes the microscope off of our communities, and it forces institutions to have to actually be accountable to the kind of inequalities that they perpetuate.
Right. Oh, I love that. Yeah, we'll go one or two more questions in the room, and then we've got a comment, and then I know we're like right at time.
Okay, so I'm gonna go back to the question that we talked about earlier about communities coming together. So COVID is the worst thing that I've ever lived through. So, but it also, in my mind, presents a perfect storm, because all of you have worked on some aspect of research around that topic. I can't help but to think that your counterparts in different groups have been doing the same thing. So how do you come together as researchers and talk about us as a whole? You know, so because somebody said we're the majority minority, something like that. You know, when you think about African Americans, Blacks, Hispanics, you know, Latinx, Indigenous, all of that. So how do we bring us together? Because y'all talk the same language to researchers. How do we bring us together to address this issue as us? I don't know if that's even answerable.
Amber.
So I think there's been a lot more collaboration, a lot more like interdisciplinary collaborations going on, but I think that COVID-19 brought up the need for even more, because it's so easy, because like I work for PMI, it's so easy to get so focused on what are the genes doing, what's the expression, what is this like, what's the variation, that we kind of forget that it's in a social context. And so I think that there's actually need for more studies that take the social aspects and mirror that, or kind of marry that with the biomedical studies that we're doing. So I would hope that through this pandemic that would hopefully mean more like conferences like this. I don't have a social background whatsoever. I'm, you know, STEM all the way, but this is where I want to be going, is more social mixed in with the biomedical research that I do.
But how do we get Latinx, Indigenous, Black, all the others, how do we get them that's doing all of that research together and get them to help send that message?
I mean, I think we can do it, you know, on an individual level, but I also think that the universities can incentivize spaces that really help that happen, whether that be through interdisciplinary grant funding, the writing spaces that were created through ASU that I take part in. There are all sorts of ways that it can happen on our own will, but it can also be supported by the institutions.
Yeah. And I would also argue that there is, I'm a firm believer in cluster hires, that when you bring people together, you know, and bringing in, convincing a provost to fund a cluster around BIPOC health disparities, and bringing in scholars who look at these from different communal vantage points and different disciplinary vantage points. That would be and I think that would be a sell. So you've given me a good idea. I think that would be a sell. But also it's the question of, do folks see themselves as being in community with people like me? That's the other question that my personal experience would tell me that scholars outside of ethnic studies, whether it's Asian Pacific American studies, Chicano Latino studies, Black studies, we tend to see each other as being in solidarity because we study our communities. We have a certain ethic of connection. When I move into applied fields and I'm working with scholars across racial ethnic groups, they don't necessarily see themselves as being my ally or being in solidarity with me. This is like research for them that advances career. So I think that that's also, we have to acknowledge that Not all skin folk are kinfolk. And there's a lot of academics of color who are very invested in their own come up. And while on some levels, I think work that hustle, that's great. I don't think that, especially inside the area of community-based research, that does a disservice to our larger communities. And so finding the people, like I'm very grateful for this space because I feel like I've found other scholars who have the same ethic of care when they show up to do this work. Not everybody has that. And sometimes we make the false assumption that people have that and we get burned, right?
Let's round the base with Dr. Davis here, round home base
Oh,
here,
yeah, just
please.
very, very short. I
Please,
just
no.
wondered, I call it window dressing. I don't know if you know what I mean by the notion of window dressing. And sometimes many of us, I believe we spin our wheels because those who are in upper administration or in other organizations, corporations, oftentimes will only want, say, for example, will want someone in diversity, equity, and inclusion, a director, because it will make the organization look good. That's what I mean by window dressing. And we may be going, yes, we've got someone in that position and really feeling things are changing, when all it was window dressing. So that it, and maybe you're hired to dress the mannequin in the window, but it's still you and the mannequin are out there window dressing the window, and you're not really taking the issues that all of us have been talking about today. Now that's enough to mess with your head. That's enough to really mess with you because you think you are passionately putting everything in when all you are is spinning your wheels because it's just window dressing. What do we do? So my question, if maybe it's still part of your question, how do we infiltrate, how do we inject the reality and the truth to that, speaking truth to window dressing? That's what I mean. How do we speak truth to window dressing?
Well, window dressing is not consistent, and seasons change and styles fall out. And so I think you have to be in community with the right people who are doing the work. And what I have experienced is that as long as you're part of a network of support across the university, right? Power is not top down, power is everywhere. And so when you are part of a larger collective of folks who are committed to the work, it really doesn't matter what window dressing is doing. It doesn't even matter what upper administration is doing, because you all are down here doing the work. You're in community. So when I see the work that you're doing, I'm like, that's who I need to know. Not the person who's running the show. I need to know the person who is the influencer, who has their ear to the community and who has the faith and trust of the community, because that's real power. Positional power for us, that doesn't help us, but influence helps us. And we work in critical mass.
Thank you so much for that. Yeah, please. And then we've got to go to a comment here, but please, I want to make sure we get to you.
I was just going to say amen, hallelujah. I mean, you know, that's all I was going to say. But okay, so this is really interesting. So I don't want to go too far, but I just want to say, so I'm a Black woman. I was adopted and raised in a white home, really a multicultural home, with a social worker who worked in inner city Minneapolis and a public health nurse. Okay, but that was my raising. So I certainly learned, code switching and how to speak and be, in various environments in a very, kind of in a, dichotomous way, if you will. But I say that as I walk my walk, it doesn't matter, right? How the window dressing is going to happen. But now, now I'm over 50 and all that. So I say that as part of the excuse, but I just have to show up authentically. And so that people know that ethic of care is what I'm bringing to the table. And so if you're going to ask me, and I've had these discussions, if you're going to ask me to communicate and research with the Black community, let me be frank with you about how I feel and what my expectations are. Now, that's pretty audacious for just a student, but it's the only way I can survive. That's self-care. That's survival, is to show up with determine what that ethic is and just bring it everywhere. And I'm not going to be, that's not the window dressing they may want at this time. And that's okay with me. Let's just put it out here because I know the difference. I was raised one way. I am a different way. You know what I'm saying? And so I say all that to say that I speak it, I learn it, I've seen it, I've lived it. So I can speak to it, but I also can stand in my space and say, nah, that's not what I do. So, and there's consequences to that, but it's a self-preservation tactic. It's the only way I can do it.
Before I get to this final comment, I just wanted to thank everyone for participating today, as well as our online participants. And thank you for the speakers and the panelists. Thank you so much for coming up from Phoenix. We really appreciate you and all of your contributions to this field. And I think it's totally fitting to end with this comment, but El Yazi says, this was a great presentation. As an American Indian, I related to some aspects of what was presented and appreciated the land acknowledgement. Thank you.
we leave, we need to, yeah, Jermaine, thank you. And we need to share. Listen, Dr. Evans, I just want to share with you, Dr. Evans, I was saying, over lunch, no, I'm gonna make you cry. I'm gonna make you cry. I said, Dr. Evans, it's interesting about community because we've worked together on this, I mean, with arms locked and whatnot, but it was only about an hour prior to arriving here to this meeting, this gathering, that we ever met in person. But yet, I was like, oh, girl, you coming down to Arizona or to Phoenix? Oh, I'll be gone. You can stay at my house. I mean, and I think, oh, this is somebody I never even met in person, but it's the ethic of care. It is the community. It's the common goodness and desire for well-being and the authenticity that resonates from you. And granted, to have, the audacity to suggest and, Live Black Experience panel in Flagstaff, Arizona, and to honor those here, that have created space and community and here through the Murdoch Center, through NAUs, communities, coalitions to support Black students and so on. I mean, that you have the audacity to do it. And I appreciate now having that type of audacity does come with consequences. It does. Good or bad, someone else recognized who you were and what you could offer, and they stole you. They have stolen you. So I just want to stay now though and say thank you so much for allowing us to show up in this space and for sharing and being committed by any means necessary to give this information back to the community, that we wouldn't dare sit and listen to the stories without giving back and making sure that even if it's a little amount that folks get paid. I mean, that was you. Yeah. Yeah, I demanded it, but I have no power, I had no power. So, and also being here for such a short time. And for you to, like a surgeon, be able to pinpoint these sources of power and bring them together. But somehow you were able to cultivate that, galvanize that. So I just, I've taken up a lot of time here, but I just want to tell you what an incredible impact you've made on me and on this research from NIH. It's really been you and me. And yeah. And I was paid for it and I made you. I was like, will you please help me? Will you please? And she said, of course, so it was over and above what you needed, what your call was. So thank you so much. I love you for that. You might leave, but you can't get rid of us. Okay. Any last words? Okay.